right? So regarding this topic, I think that I believe that everyone really care about this topic during pandemic. You know, uh, maybe before pandemic, right? You do not care about that until the moment one of a family member gets sick. That is the moment to you to care about that. When the moment when you are not feeling well, okay, that is a moment to you to care about that. Correct. So that's why during pandemic, I think that everyone care about that, right? If you are afraid of COVID-19, it means that you care about that. Correct? You care about that. Then can you imagine that? Why I said that? Can you imagine that during pandemic, based on the data right now, based on the record right now, as of now, there are more than 6 million people in the world die of COVID-19. If we talk about Philippines alone, okay, even the situation of COVID-19 is getting better recently. But based on the record in the Philippines, more or less 57,000 person Filipino die of COVID-19. Okay, so right now what we are talking about is number, but behind the number, one number is one family, right? Assuming 5 to 6 family member per family, it means that there are 5 to 6 times more or less 60,000. That is more than 300,000 people suffer from that, especially even you are not the one who suffer from the COVID-19. But whenever, fortunately, because of COVID-19, you lost a family or even a relative, you feel very disappointed, you feel very depressed, you feel very sad. So this means that you are affected by the COVID-19 also. So it's a reason why I said that health, right? That is the reason why we always said that, I believe that if you are unhealthy, you are unhappy also. So that's why the basic requirement to have a happy life is a healthy life. Then I like to give this kind of example, our health, just like the saving in the bank, just saving in the bank. And God is very fair to everyone. When we was born, when we were a newborn baby, actually the saving in the bank for everyone is the same, except genetics problem, inheritance, right? If you talk about inheritance, since was born, of course they carry some disease caused by the genetics. That is a special case. Okay, except inheritance, except accident. Actually, the saving of everyone in the beginning when we were born is the same. Assuming the saving in the beginning is 100 peso, right? So at this moment, we do not know how to take care of ourselves. Then little by little, we spend money from the saving. We have to withdraw money from the saving. So little by little, the saving in the bank is getting lower day by day until the day there is no more balance. That is a moment to us to find out, oh my goodness, I'm sick. How young you are. When the balance in the bank is zero. When the saving in the bank is negative. If 90 years old, what I can say is congratulations. Can you imagine that you spend 90 years to spend over saving in the bank until you reach 90 years old, then no more balance. That is a moment to you to face on the illness, to face on the death, right? But if the answer is only 30 years old, 40 years old, we are very sorry. We are very sad to hear about that. Can you imagine that 30 years old, 40 years old, but the saving in the bank, the saving of health in the bank is negative. It's utang. That is the reason why it's a moment to us to find out what is the solution, to deposit the saving back. But honestly, we have to prepare in advance for a raining day. We call it prevention. That's why, that is the reason why I always said that your health is your wealth. Okay, so actually before we have discussed, right? Whenever we got sick, of course, we have to know what is the cause of a disease. If we are unable to know what is the cause of a disease, sorry to say that we would not be able to solve the disease at all. Okay, whenever we do not know what is the cause of a disease, at the same time there is the prescription from the doctor, I can tell that the prescription is wrong, caused by caused by the misdiagnosis or caused by wrong prescription. Okay, so even there are so many factors, so many causes of a disease, but actually, I have to say that the only real cause of any disease is our cell. It's our cell. We call it lifestyle. Okay, so that's why I always say that when you get sick, where you go? You go to the doctor. But I'm sorry to say that doctor is not the one who make the disease for you. You know, it's useless if you look for doctor. If you ask doctor, you have to ask yourself, why lifestyle is the main cause of any disease, aside from all the causes I have mentioned before. Okay, based on the study of the WHO, World Health Organization, WHO, based on the study from WHO, the study is only for health. Okay, do not talk about any specific disease yet. Just talk the general study for the general health. That is the key law of the health. Meaning to say, what is the factor of the health? Okay, based on the study, actually for our idea is that, you know, especially our member, our distributor, when they want to know more about our product, the first question for us is that there is any side effect or not. What they care is the side effect. Okay, what they care is the side effect. But do you know that based on the disease analysis, you know, you can see it. Number one is an inheritance. Okay, inheritance is 15%. And like what I mentioned a while ago, if what you care is a side effect of medication, but the medical support in this study only 7%. If you talk about the environment, either the natural environment or even the social environment, all in all, only 18%. So all in all, it's only 40%. So what is others? 60%. 60% is lifestyle. So based on this study, the meaning is that lifestyle is the key law of our health. So in this moment, whenever our health condition is not go good, so what is the main factor? The answer is lifestyle. Okay, so a while ago I said that do not talk about the specific disease. Right now, okay, we go to the specific disease. We do not talk about other disease like the chronic disease. What is a chronic disease? For example, like hypertension, like gouty arthritis, okay, like the liver cirrhosis, like the diabetes, psoriasis. Okay, those the disease I mentioned. We call it a chronic disease. We do not talk about chronic disease. We talk about cancer alone. We just talk about cancer alone. Why we talk about cancer alone? Okay, right now the number one death. The number one death in the world, wherever, is cancer. Can you imagine that right now the percentage of the deaths caused by cancer is up to 75%? Do you know what's the meaning of a 75%? The meaning of a 75% is 1 out of every 4. No, 3 out of every 4 die of cancer. So right now, much easier to be a doctor. You know, how easy? Why? Okay, whatever the patient go to you, you know, more or less cancer. Okay, because 3 out of every 4 is cancer. Can you imagine that the percentage is so high, right? So right now we are talking about what is the cause of the cancer. The cause of the cancer. We just talk about cancer alone. Okay, the same as what I mentioned a while ago. Maybe what you're concerned is the side effect of a medication, right? That is the reason why you are so careful to take medication. You are so careful to choose any product for you. But based on the study under WHO, the medication is only 1%. The same as what you can see right now, the medication, right? Maybe what you think is maybe it's caused by the pollution, right? But I'm sorry to tell you that the pollution is only 2%. If you talk about cancer, okay. So at this moment, you said that I just drink the alcohol every night. It's okay. right? It's okay because it's safer than the medication. But sorry to tell you that based on cancer, alcohol is more dangerous than medication because alcohol is a 3%, right? How about the infection disease, right? How about infection disease? What's the infection disease? For example, Hep B is an infection disease, right? For example, HPV is an infection disease. For example, COVID-19 is a respiratory system infection. It's an infection also. But can you say that? Can you see that? The infection disease is 10%, right? Including others, including the food we are eating, like the artificial flavor, 1%, unsafe sexual activity, 7%, right? Even the sunlight, UV, right? Sunlight, 3%. Profession caused by your profession, caused by the business you have, 4%. So when you add all the percentage, oh, that's only 35%. Only 35%. So it means that what I mentioned a while ago is not the main cause of this or of a cancer. So what is the main cause of the cancer? Okay, you can see the bigger part. The bigger part. What is the bigger part? Okay, smoking, 30%. Then wrong eating habit and diet control, 35%. So 35% plus 30%, that is 65%. Meaning to say, if you are the smoker, at the same time, you do not have a really correct eating habit and diet control, sorry to tell you that you will be the one of the 75%. No question, no wonder, no doubt at all, based on the study of the WHO. Okay, so what I'm going to say is that that's what I say. You are the one who make the disease. Then you are the only one who can solve disease by yourself. No others, not your family, not your wife or husband, not your parent, not your doctor at all. You are the only one because you are the one who lock it. You are the only one who can unlock it. No others at all. Okay, so that is the lifestyle. So at this moment, okay, you agree because of lifestyle. Even you want to solve the lifestyle, but you do not know what is the lifestyle where you can change, right? Where you can change your lifestyle. Okay, at this moment, we can separate our lifestyle into 4 parts. The first part is the proper rest. The second part is the stable emotion. The number 3 is exercise. The number 4 is the eating habit and diet control. Okay, how the lifestyle, how these 4 heal us step by step, little by little, day by day. Okay, the number 1 killer, I suppose to let you to ask, right? Among these 4, wrong eating habit and the diet control, and no exercise at all. Okay, and very stressful and insomnia. I suppose to let you to ask, what is the top killer? What is the number 1 killer among these 4? Okay, never mind. You will understand. Okay, because right now I have shown it. Top 1 is emotional stability. Okay, we call it a stress. So at this moment, maybe you disagree what I say. Stress is the number 1 killer of our health. Okay, because why? Because we used to have a stress already. But sorry to tell you that whenever you are stressful, whenever you are emotional, when you got mad, of course, you will not see the effect from the stress or anger directly. That is the reason why you do not know that is the risk, that is the dangers caused by stress. Especially stress, very dangerous to the whole body system. Okay, when we say that the whole body system, we can separate our body system into 8 organ system, 8 to 9, even up to 10. For example, cardiovascular system, respiratory system, digestive system, urinary system, metabolism system, endocrine system, reproductive system, okay, including skin and our bone. Okay, all in all, 8 to 9 body system. But what I'm going to say is that the stress is effective to all of the system. Okay, you just you just have a little idea. Do you still remember when you get mad? I believe that all of you have experience about the stress. All of you experience about anger. You know, maybe before we go to the meeting, you just have a quarrel with your family. That's why you are before the meeting, you are very stressful. Then you are very emotional. You are very angry, right? So do you notice that? You know, whenever you get emotional, all of a sudden you feel that you have a palpitation. But maybe you do not notice that palpitation is caused by the stress and the anger you have a while ago. Maybe you experience the breath difficulty, right? Cannot breathe, But you do not know that the breath difficulty is caused by stress you have a while ago. Maybe you experience palpitation. You experience headache, migraine. Maybe because of the stress tonight, that's why you are unable to sleep properly tonight because you think about the anger you have, right? Then you experience the stomach aching. Maybe you experience the constipation whenever you are emotional, right? For a long time. Maybe you experience the joint pain. You experience the body pain, right? Oh gosh. Especially if you are you are very stressful recently. At the same time, aside from the stress you have, very unlucky to you is that you got an infection disease like the common cold and the flu. Why? Because immune system. Okay, so it's best stress. The effect of a stress is right away. It's right away. So if you are stressful all the time, it means that you are killing your body cell all the time. Okay, when you kill your body cell once only, you will not see the disease. You will not see the effect right away. But if you are keep on doing that, because the stress is is the per second, per minute all the time. That is the reason why the risk of stress is very dangerous. The second one is insomnia. Yeah, number one is insomnia. Maybe you disagree what I say. Insomnia is the number one killer. Up to now, I suffer from insomnia for 10 years already. Up to now, I'm still alive, right? No, I disagree. You have to agree based on the clinical study. Insomnia is the top 2 killer, right? Can you imagine that the insomnia? Honestly, aside from the body, the one of the risk of insomnia is suicide. Suicide. Can you imagine that the insomnia? You suffer from insomnia for 10 years already. So can you imagine that your lifestyle in the past 10 years? My question for you is that, gosh, you spent 10 years already, but up to now you are unable to solve it. Your answer is that, yes, I went to so many doctors, I followed so many medication, and the medication is effective in the beginning, and later on you have to increase the dosage. If you do not increase the dosage, you cannot see effect anymore. Then even you increase the dosage, and later on all the dosage, the high dosage is not effective to you as well. That's why you stop it. You have no patience for that. That is the reason why you suffer for 10 years already. But can you imagine that? Insomnia, the feeling of insomnia is very terrible, especially in the midnight. You are very sleepy, but you are unable to sleep. Your body is so tired. Even you lie on the bed, so tired, but you are unable to fall in sleep. You feel much tired. And the same time, you feel very sensitive, especially in the midnight, very quiet. You can hear everything. Even you can hear the insect. You can hear the Mickey Mouse. You can hear whatever. Okay, very sensitive. Even like the joke we make, even just only one needle, drop one needle, you can hear the sound of the needle. Can you imagine that? At the same time, even you have so many friends, so many colleagues in office during the daytime, but whenever in the nighttime you are alone, what you feel is not. What you feel is a loneliness. Since that the whole world, you are the only person who is surviving. Can you imagine that the loneliness? So at this moment, if you do not have a strength enough to overcome the loneliness caused by insomnia. That is the symptom, that is the risk of suicide. Can you imagine that? Aside from the feeling of the insomnia every night, what is the risk caused by insomnia? You know, the risk, the damage from the insomnia is all in one also for the whole body. Based on the clinical study, whenever your sleep is lacking of 2 hours every night, okay, compared to the standard, the normal hour of sleep is 7 hours, 7 hours a day, okay? Okay, 7 hours. The standard is 7 hours every night. Okay, then if based on the study, if your sleep is only 5 hours, lacking of 2 hours a day, at this moment, the percentage of the risk to get cardiovascular disease. What is the cardiovascular? Okay, whatever, like the hypertension, like the heart attack, heart enlargement, or the cardiovascular disease increased by 50%. Okay, you check the hour you sleep every night. If your sleep is less than 5 hours every day, so at this moment, of course, hypertension is necessary to you. Okay, but sorry to tell you that you did not know that the hypertension you have is caused by the insomnia you have. The second one, whenever your sleep is lacking of 1 hour a day, the percentage of the risk to get type 2 diabetes increased by 10% every 1 hour. Okay, 10% increase by 10% every 1 hour. So meaning to say is that if you are lacking up 2 hours every night, okay, you just sleep only 5 hours compared to 7 hours. At this moment, the percentage of the risk to get the type 2 diabetes is not 10% at all, times 2, 2%, 20%. If it's 3 hours, 30%. Because based on the study, it's the 10% every 1 hour. And to remember that 10% to 40% of a diabetes patient, aside from diabetes, they have a hypertension. That is the reason why hypertension is necessary if your sleep is lacking of 2 hours every day, including cancer, like the breast cancer or colon cancer. Whenever your sleep is lacking of 2 hours every day, at this moment, the percentage of the colon cancer, the percentage of the breast cancer increased by 50% as well. How about immune system, like the infection disease? If your sleep is lacking of 2 hours, at this moment, the risk to get the infection disease such as UTI, common cold, and the flu increase by 400%. Can you imagine that? Can you imagine that? That is the reason why stress is the #1 killer. #2 killer is insomnia. Another one is the proper exercise. Okay, exercise is very important, because exercise is the best way to improve your blood circulation. Whenever your blood circulation is very poor, you will not be able to deliver the nutrition, you will not be able to deliver oxygen to your body cell at all. Even you have the best oxygen, even you have the best medication or nutrition, all the best you have is useless because caused by cardiovascular disease. Okay, so at this moment, exercise is the one of the solution. But there's one problem caused by no exercise. We call it the obesity. Obesity. Okay, the same as what you can see here. If your problem is the obesity caused by lacking of exercise, okay, at this moment, you can see the risk of diabetes increased by 500%. And you can check when you see the person who is very, very big, very fat, okay, more or less diabetes, you know, you can be very good medical doctor, based on the looking they have, more or less, you can guess what kind of disease they have already. Okay, based on their body weight, more or less, you will know what is their lifestyle. Based on the lifestyle they have, more or less, you will know what the disease they are going to get, right? So diabetes increased by 500%. How about hypertension? Like what I say, right? 10% to 40% of the diabetes patient, aside from the diabetes, they have a hypertension. Okay, right now we talk about hypertension alone, caused by obesity. Okay, if it's overweight, the risk of hypertension increased by 350%. How about the gallbladder stone? Gallbladder stone increased by 300%. Gout, 250%. So if you have a gouty arthritis, then you cannot walk properly. But I'm sorry to say that it's normal, it's necessary. No surprise at all. How about heart attack? The hypertension, heart enlargement, heart attack, 200%. Right? If you have a gout, okay, of course, there's a gouty arthritis. Aside from the gouty arthritis, because of overweight, of course, the joint part is very weak. So arthritis, general arthritis is necessary. Okay, even just like the osteoarthritis. Usually, you will reach 60 to 70 years old. That is moment to you to fear to experience osteoarthritis. But whenever you have overweight, okay, just even you are only 30 years old, 40 years old, I'm sorry to tell you that you will have osteoarthritis already, even you do not have a gout at all. Okay, infertility, no baby at all, no production at all, increased by 300%. How about cancer? Based on different kind of cancer, but the percentage of those cancers more or less from 100% to 700%, including reproductive system. Wow. That is the reason why Chinese said, longer bell, shorter life. How long is your life? Based on how long your bell is. When we measure how long is your bell, we will know how long is your life already. So meaning to say is that if you want to longer your life, so you have to shorten your bell as soon as possible. What is the best way to shorten the bell? Okay, the best way is exercise, your lifestyle. Okay, so when you talk about that, you can check it by yourself. From the top 1, top 2, top 3. Okay, you can check by yourself. It's the checking list. It's a checking list. You can click check. Okay, number 1, you are very stressful, you are very emotional every day. Yes, okay, check it. Okay, then you cannot sleep properly most of the time. You suffer from insomnia. Yes. Okay, if you suffer from insomnia for more than 10 years, you need a double check. Okay, you have so many checks. Okay, then number 3, wow, based on the weight, yeah, really overweight, check. And do you have exercise? Oh, guys, do not talk about exercise today or the exercise yesterday. I did not have exercise for more than 10 years already. Oh my goodness. Okay, you can check it by yourself. Okay, top 4, long eating habit and diet control. There is a good saying. The saying is that a crossed mouth catch no fly. A crossed mouth catch no fly. Okay, this saying is only good for the infection disease before, right? Infection disease before. Because whatever you eat, whenever there is a bacteria, that's why it's a moment to get the disease. But sorry, this sentence, this saying is not only for the infection disease, including the chronic disease right now. Like what I mentioned a while ago, like hypertension, heart enlargement, okay, liver cirrhosis, diabetes, arthritis, kidney disorder, whatever, all those are chronic disease. What's the meaning? It's caused by your mouth. That's why we said that based on the dishes, based on the food on your dining table, we know what kind of disease you have already. For example, the food you have every day, on the table is always the oily, very oily. Always is a fry. Okay, it's a fried chicken, fried pork, fried fish, everything is a fry. No steam at all. Okay, no boiling at all. All is the fry. Always is a grill. Always is a barbecue. Okay, At the same time, all is the meat, no vegetable at all. Then all the drink on the table is a Sprite and the Coke, like the one, right? Right? Fast food. Fast food is a fast to die also. Can you imagine that? If the food we have eaten every day, like the picture, right? All is the no nutrition at all is the calorie, all is the starch. Can you imagine that? So that's why I said, based on what kind of food you are eating, we will know what kind of disease you have already, right? Especially the food we are eating right now is not under our control at all. Just like what I ask all the time, right? For example, like what I mentioned a while ago, everyone right now is very careful to take medicine because of side effect of the medicine. So sometimes, because too much careful, sometimes even the medication is necessary, but they still avoid to take it. It's very dangerous. Whenever it's necessary, have to follow it. Otherwise, it's very dangerous. Okay. Then, like what I said, some people really too much careful, right? Especially, antibiotics, right? Because of a drug resistance. That's why, avoid to take antibiotics. But I'm sorry to tell you that. Okay, my question is that, do you take antibiotics today? Your answer, no. I do not take antibiotics for many years already. Even whenever I have a symptom like the COVID-19, I do not take any antibiotics at all. How come I take antibiotics, right? I do not take. Okay, so my next question is that, do you eat chicken today? Do you eat pork today? If your answer is yes, if you eat pork, if you eat chicken today, it means that you have eaten antibiotics. Because antibiotics is the protocol of the feed for the chicken and the pork right now. It means that they have to inject the antibiotic to the chicks. The second one, they have to add antibiotics into feed, daily feed. They feed antibiotics every day. So at this moment, the moment you enjoy the fried chicken, at the same time, you are enjoying the antibiotics. That is the reason why now, okay, that is the reason why the percentage of the cancer is very high. The second one is that is the reason why there are so many people do not take antibiotics all the time, but they have a drug antibiotics resistant. They have antibiotics resistant. Whenever it is necessary to them to take antibiotics, they just notice that antibiotics is not effective to them. Why antibiotic is not effective to them? Because drug resistant. I did not take the drug all the time, but how come I have a drug resistant? The drug you have antibiotics, you have, okay, or the resistance of the antibiotics you get is from the food you are eating. So that is the reason why the best way to solve the disease is change your lifestyle. Change your lifestyle. Okay, but the question is that, yeah, if you talk about exercise, I can decide to do the exercise tomorrow right away. Okay, regarding the eating habit and the diet control, yeah, maybe I can decide not to eat so much meat, or I stop to eat the meat from tomorrow. I can change myself. But my question is, my problem is, I cannot sleep. Even I want to sleep, I'm unable to sleep. It's not under my control, right? I like the stress. I don't want to get emotional. I don't want to get mad. I don't like the stress at all. But the moment I see the face of my wife, when the moment I see the face of my boss, I'm very stressful. I'm very emotional already. I don't like it, but I cannot avoid it. So, okay, Dr. Allan, what is your solution? Since it's very easy to say, but it's not easy to solve. That is the reason why we have a product presentation tonight. Okay, so the science behind Blessingswave product, we call it quantum medicine. Welcome to the quantum future. So at this moment, what is the quantum? Tonight, 2 weeks ago or 3 weeks ago, the topic I give, that is the explanation of a quantum. That's why tonight I will not explain the detail. What is the quantum? Okay, we just choose, treat quantum medicine as common sense. Okay, as a common sense, assuming all of you understand what is the quantum already. So I just want to give you the idea only. Okay, so what is the quantum? Quantum is the smallest and the basic composition of everything in life. Okay, for example, if you talk about water, the smallest and the basic composition of the water molecule is not atom at all. Atom is not the smallest, not the basic composition of water. What is the smallest? What is the basic composition of the water? Not atom at all, not nuclear at all, not proton at all. The smallest and the basic composition of water is quantum. Okay, aside from water, if you will talk about others, okay, even the table in your house, okay, the smallest composition and basic composition of the table or chair you have is quantum. Okay, everything is a quantum because quantum is the smallest and the basic composition of everything in our life. That is a quantum, smallest particle. Okay, so at this moment, what is the quantum? Quantum is a super high frequency energy wave. Even under vacuum stage, even under 0 degree, quantum is keep on moving and the vibrating and the motion. Okay, so quantum is a high frequency energy wave. So meaning to say is that when you talk about quantum, it means that you are talking about frequency. When you talk about quantum, you are talking about energy. When you talk about quantum, you are talking about wave. When you talk about frequency, frequency is the vibration, because vibration is the number of the vibration per second. We call it frequency. So it means that when you talk about frequency, of course, you are talking about vibration. So what's the meaning? Quantum is the frequency, quantum is a vibration, quantum is energy, quantum is wave. Understand? So that is the reason why the one of the greatest scientists in the world, Albert Einstein, said, everything in life is vibration, because everything in life is quantum. That's why everything in life is vibration. Everything in life is frequency. Everything in life is energy. Okay, that is the reason why another one of the greatest scientists, Nikola Tesla, said, if you want to find the secret of the universe, what is the universe? Everything in life is a universe. If you want to find the secret of the universe, since in terms of frequency, vibration, energy, right? The same as our human body, our human body is the part of everything in life. So if you want to find the secret of a human being, since in terms of a frequency, vibration, and energy. So at this moment, disease is the part of a human being. So if you want to find the cause of any disease, whatever you have, since in terms of vibration, frequency, energy. Okay, because quantum frequency is the smallest and basic composition of everything. That is the reason why, based on the definition of the quantum medicine, wrong frequency, wrong vibration, wrong energy, wrong information is the cause of any disease. Okay, if the wrong frequency is the cause of the disease, at this moment, the medicine you have to take is not the medicine of a chemical. You have to take the medicine of the frequency, the medicine of energy, the medicine of a vibration. That is the reason why Albert Einstein said again, future medicine will be the medicine of the frequency. Why the future medicine will be the medicine of a frequency, not the medicine of a chemical? What is the medicine of a frequency? And because wrong frequency is the cause of any disease, whatever you have. And because frequency is the basic and the smallest compensation of everything, which is a quantum. Understand? That is the meaning of the quantum medicine. Okay, that is the reason why a while ago I mentioned ahead the definition of a quantum is that quantum medicine is the only cause of any disease. So in other words, as long as you are able to adjust, as long as you are able to correct the wrong frequency in our body into correct frequency, whenever frequency in our body is correct, then the disease is gone. That's why correcting frequency, adjusting frequency is the best and the only solution for any disease, whatever we have. Okay, give you the example. Why wrong frequency is the cause of a disease. The best example and the basic example is insomnia. Okay, insomnia is not disease yet. We call it the sleep disorder. It's only disorder. But if you are unable to solve the insomnia as soon as possible, insomnia can be the cause of so many diseases like what I mentioned a while ago. Do you remember? Do you remember the disease I mentioned a while ago? Whenever you are lacking of 2 hours sleep every night, then the percentage of the risk to get cardiovascular disease increased by 50%. Do you remember diabetes? Right? Increased by 10% every 1 hour. Do you remember? Breast cancer, colon cancer increased by 50%. Do you remember? Infection disease, right? Like the common cold, flu, UTI increased by 400%. Wow, you see? Right? So that's why I said that even insomnia is not disease. We call it a sleep disorder. But if you are unable to solve insomnia as soon as possible, insomnia can be the cause of the next disease we will get. Okay, so what is the cause of insomnia? My answer for you is depend. Depend on the definition. Depend on the definition. Right? Depend on the definition. Whenever the definition is different, at this moment, the cause is different. For example, based on the definition of the chemistry. Okay, it means that from now on, what we are going to talk is only chemistry, no others at all. From now on, we are going to talk is a chemical, no others at all. Based on the definition of the chemistry, the cause of the insomnia is caused by wrong production of specific chemical composition. Okay, why we are talking about specific chemical composition? Because right now we are talking about is the definition of the chemical. That's why we are talking about the chemical composition. Okay, but why is it specific? Because there is a specific composition for specific function or purpose, right? And what's wrong? What's wrong? Because caused by the production is wrong. Whenever the production is too high, it's too low, too few, or too much, of course, it's not balanced, it's wrong, right? So that is the reason why, based on the definition of chemistry, the cause of insomnia is caused by the wrong production of a specific chemical composition, which we call is melatonin. Because the production of melatonin is wrong, it's too low. Lacking of melatonin, that's why you are unable to sleep. Lacking of this kind of specific chemical composition, that's why you are unable to sleep. So at this moment, whenever you cannot sleep, then you go to the medical doctor, you go to the chemical doctor. Based on the idea of a chemical doctor, based on the idea of a chemical medical doctor, the cause of insomnia is caused by low production of melatonin because it's the chemistry. Oh, okay. So if the problem is caused by the low production of melatonin, lacking of melatonin, that is the reason why the prescription from your medical doctor always is the melatonin supplement. Supply the specific chemical composition for sleep, which is the melatonin to help you to fall in sleep. Okay, that is a solution. But the problem, the problem is that in the beginning it's effective. Then later on, it's not effective at all. Next time I will tell you what's the reason why. Okay, I will tell you what is the reason why it's not affecting to you. Again, that is caused by your body. Okay, the second one is that, but I don't like to rely on the melatonin supplement forever. I want to know what is the real cause behind the low production of the melatonin. Sorry, no answer for that. So what is the answer? The answer is that based on the definition of a quantum medicine. Based on the definition of a quantum medicine, the cause of insomnia is caused by wrong frequency. Do you remember a while ago I said that? Right? Based on the definition of the quantum medicine, wrong frequency is the only one cause for any disease, whatever you have. So right now we are talking about insomnia. So at this moment, what is the cause of the insomnia based on the definition of a quantum medicine? Of course, the answer is wrong frequency. Okay, for example, the specific frequency, which is 3.5 to 7 hertz. That is the correct frequency and the specific frequency for specific chemical composition. Okay, 3.5 to 7 hertz. That is the correct frequency and the specific frequency to inform your body, to activate your body to produce specific chemical composition, which is the melatonin. So whenever the brain frequency is not in between 3.5 to 7 hertz at all, caused by some factor. What is the factor? For example, the quarreling with your wife. For example, the stress from your boss. For example, the side effect of the medication. For example, the finance situation during pandemic. Oh, that's why the frequency in our brain is not in between 3.5 to 7 hertz at all. That's why the information, the frequency we send to our body is not 3.5 to 7 hertz at all. It's not for melatonin at all. That is the reason why the production of the melatonin is too low. Another example, 7 to 14 hertz. That is the correct frequency, specific frequency to inform our body, to activate our body to produce specific chemical composition, which is serotonin, dopamine, endorphin. Okay, whenever our brain frequency is not in between 7 to 14 hertz at all. So at this moment, the production of the serotonin, dopamine, endorphin is too low, not enough. We call those hormones, serotonin, dopamine, endorphin, as happy hormone. Whenever your body is lacking of a happy hormone, that's why you did not feel happy at all. That's why we call it depression. We call it anxiety, including especially like the endorphin. Endorphin is the best painkiller, nature painkiller. Whenever lacking of the endorphin, then we will experience the body pain, nerve pain, joint pain, wherever it's painful all the time because lacking of the endorphin. Okay, so do you notice that? Do you notice that all the problem, even insomnia, even depression, anxiety, is caused by wrong frequency? Okay, so frequency is a specific language, it's a specific information, it's the way for the communication among our body cell. Okay, those information we call is a biosignal. Okay, the function of a signal is for information, for message, for order, for instruction, for communication. Whenever the signal is wrong, it means that information you are going to give is wrong. Message you are going to give is wrong. The instruction you give is wrong. Okay, and the wrong communication, misunderstanding is the reason why everything in our body is wrong. Okay, that's why we call it disorder. Did not follow follow the order anymore. So at this moment, the way to solve the wrong frequency, to correct the wrong frequency, we call it bioresonance therapy, BRT. B is means biosignal, like what I mentioned a while ago. Resonance, through bioresonance to adjust, to change the wrong frequency in our body. Okay, so at this moment, maybe you have idea about bioresonance, biosignal, but what is the resonance? Actually, resonance is really a common sense also. Okay, like the example I like to give all the time. Whenever there's the big truck pass by your house, because of a vibration of an engine, then all of a sudden you can hear your window, your door, it's vibration. Right? It's a vibrating. That's why you can hear the sound from the window and from the glass from the door. That is the caused by resonance. That is the resonance between engine and your window. Okay, the same as the sound wave resonance. The reason why you are able to hear my voice, to hear my explanation tonight, that is caused by sound wave resonance. My mouth is the transmitter, is the one who delivers the frequency. Okay, your eardrum is the receiver, receive the frequency I send through my mouth. Whenever there's a resonance, that is a moment for you to hear what I'm saying. So whenever there's no resonance, there is no hearing at all, there is no sound at all, then everyone become deaf. So I need your imagination a little bit. I need your imagination. Can you imagine that? You know, everything is normal. Your eardrum is normal. But all of a sudden, you cannot hear anything at all. Even you try to tell your family something. Even you do your best. Even you shout, okay, to tell them something. Okay, they cannot hear what you are talking about. Even you cannot hear what you are talking about. But the other function of your body is normal. But how come there is no sound at all? Because whenever there is no resonance, there is no hearing at all. There is no sound at all. Okay, that is the reason why everyone become deaf. Okay, another example, we call it a light wave resonance. The reason why you are able to see everything surround you, even the table, TV, whatever you have seen, the reason why you are able to see it, because that is caused by resonance. Whenever there's no resonance, there's no image at all, then everyone become blind, blindness. We call it a light wave resonance. The best example is colder. The best example is colder. Okay, my question for you is that, can you give me the scientific explanation? Okay, what's the reason why you are able to identify different color? What is the scientific explanation? What's the reason why you are able to identify different color? Because of a frequency. Because different color have a different frequency. Like what I said, frequency is the information, right? It's a message, right? So different color have a different frequency. So it means a different information, different message. Okay, for example, when the frequency that my eyes has received is the same as the frequency of a color red, that is a moment for me to see the color is red. If the frequency that my eyes has received is the same as the frequency of the color green, that is a moment for me to see the color is green. For example, stop light. Okay, when the frequency that my eyes have received is the frequency of the color red, that is a moment to me to see the stop light is red. That's why I stop. Everyone ready to stop. When the frequency that our eyes have received is the frequency of the color green, that is a moment to us to see, the stop light is green. That's why everyone ready to go, right? So do you notice that everyone follow the same information, follow the same instruction That's why everything is under order. Right? Everything is under order. But whenever there's no information, whenever there is a wrong information, can you imagine that just like the picture you have seen? How messy is that? It's a traffic already. So can you imagine that? Even there is no brown out, even there are so many stoplights in Metro Manila, but it's very traffic already. But can you imagine that? Whenever there is a brown out, whenever there's no stoplight, it better not to go out at all, right? So the same as the gadget we are using right now, either smart or grow. Whenever there's no signal, okay, you will not be able to call anybody. You are unable to communicate with anybody because whenever there's no signal, there is no communication at all. Whenever there's no communication, there is no cooperation. There is no function at all. Okay, that is the technology behind Blessingswave and the behind Blessingswave wristband. The beauty of the Blessingswave is that number one, we are able to detect, we are able to know what is the specific frequency for specific function in our body. Okay, the second one, we have our own technology. We call it as scalar wave technology, or we call it a hologram technology. That is a technology to infuse the specific frequency into one storage. We call this storage as hologram disk. That is the two disks you have seen behind our wristband. The key point of the Blessingswave wristband is not wristband. The most important part, the key point is the two hologram disk. We call it the modulator. That is the modulator to modulate, to adjust and to correct wrong frequency in our body. When you put hologram disk onto our body, or when you wear wristband, at this moment, hologram disk will release and deliver the correct frequency into our body through by acupoint. Acupoint is the way for the delivery to deliver the correct frequency into our body, to correct the wrong frequency, in our body. We call it resonance. After resonance, the frequency in our body is correct already. That is the reason why the symptom you suffer for a long time is gone right away. Or the bad feeling you suffer for a long time already is gone right away. That's why we call it bioresonance therapy. Okay, that is the use the resonance, the power of the resonance to adjust the wrong frequency in our body, which is the biosignal. Okay, that's why we call it the BRT, bioresonance therapy. And as of now, the wristband of the Blessingswave is the only two-in-one hologram disc in the market. Aside from the medicine frequency, okay, our wristband is good for anti-radiation, anti-5G. It's good for EMF protection, electronic magnetic field protection. Aside from that, especially the new wristband we released recently, okay, in the beginning of this year. Okay, aside from loss benefit, we add additional benefit into our wristband. It's really the wristband, okay, the wristband, the silicone brand here. We infuse negative ion, okay? So we will not explain too much negative ion. Actually, you can Google it, you can research it by yourself. Actually, there are so many people have idea about the negative, idea about the benefit of a negative ion. Okay, based on the what you can see also, right? It's good for anti-free radical. As long as it's good for anti-free radical, of course, it's good for anti-cancer because free radical is the cause of the cancer. Okay, it's good for anti-oxidation. Okay, if it's good for anti-oxidation, of course, it's good for aging. Okay, good for agent. Then it's good for bacteria, antibacteria, good for antivirus. At the same time, it's good for anti-blood clotting. As long as it's good for anti-blood clotting, of course, can improve your micro blood circulation. That is an additional benefit from negative ion we infuse. Okay, so like when I say, we are able to detect the correct frequency in our body. That's why actually in our manufacture, we have more than 20 items product. Okay, but as of now in the market, what we decide is only 3 kind of a product. But this 3 kind of a product is good enough already, can satisfy 90%, 90% or 90% above whatever you need. Okay, so number 1 is mask. When you see the color red, when you see the color is red, we call it a max or super. Okay, so what is the function of a max? Max is for maximize the energy for those people who need additional energy. For example, the person who is undergoing therapy, aside from the side effect of a chemo, of course, after chemo, the patient is very weak. The patient is very weak. You know, in the beginning, in the first 4 sections, they are able to, travel to the hospital and travel back to the house after chemo. Okay, but somebody to say that 4 sections after, they are unable to travel by themselves alone. Even they are unable to, to live alone without any caregiver or any assistant at all. Very weak already. For example, the person who is undergoing dialysis caused by kidney failure. After, dialysis, the side effect is really very strong. But sorry, no choice. As long as it's kidney failure, the only solution is the dialysis, aside from the kidney transplanted. Okay, no choice. But you have to know that the dialysis is the complication is and the side effect is very strong. Okay, so aside from those, the side effect caused by the dialysis, of course, the patient is very weak. Okay, the patient is very weak. So the mask is the best support for them. And actually, we have a very good testimony, for the dialysis patient. Okay, tonight I will not mention. Okay, I will not mention about testimony. If you want to know the testimony, you can ask the friend who invite you, can share the testimony that we share all the time, like the Dr. Malai. Okay, that is the multiple organs damage, but Blessingswave product is the one who saved his life. Okay, aside from that, for example, the patient who suffer from the paralysis caused by stroke, right? Paralyzed, cannot move at all. There's no any medication for paralyzed at all. The only solution for paralyzed is physical therapy. The only solution for paralyzed patient is physical therapy. But do you notice that the most of the paralyzed patient was unable to recover from paralysis at all? Why? Even they know the importance of physical therapy. Why? Number 1, no energy at all. If they have no energy to move at all, how they can follow the physical therapy? The second one is very painful. Whenever they follow the physical therapy, very painful. That's why, because of a pain. That's why they really stop. They really give up. Better to them to choose paralyzed forever. Really very painful. Okay, so at this moment, max is the best support for them. For those kind of people, we have a lot of testimony, okay, from the paralyzed patient. For example, before wear the wristband, they are unable to stand up without cane at all. But whenever they wear it, they can move. Okay, especially recently, we have a lot of testimony, from Bacolod City. Then the next one is calm. Whenever you see the color is violet, that is calm. What's the function for calm? Calm is for relaxation, for insomnia, for depression, for anxiety. Calm is the best killer to cure stress. Calm is the best killer to cure insomnia. Okay, is one is good for two. Two is in one. Two in one for insomnia and for stress. Like what I mentioned a while ago, the risk of a stress, the risk of the insomnia. Okay, that is the reason why I really love Calm very much. I really love Calm very much. Because Calm is really, like what I say a while ago, right? The lifestyle, the lifestyle. Number one is the stress. Number two is the insomnia. Number three is the exercise. Number four is the wrong eating habit and the diet control. Okay, then what kind of food you are going to eat is up to you. Right? If you were to exercise or not, it's up to you. But what time you will be able to sleep is not up to you. If you will get emotional or stressed or not, it's not up to you, right? It's not up to you. So what is the solution? As long as you follow the wristband, as long as you wear the wristband, automatic, you'll become more relaxing to get out the stress out. Okay, automatic, you can sleep properly. Okay, instead of a medication. Can you imagine that without any side effect? But you are able to sleep properly compared to the sleeping period. Then you are, especially stress. There's no other way to get out of stress, right? Even you talk about the vocation, I need a vocation to get out my stress. But the problem is that when you come back, you get the stress again, right? It's not really the permanent solution for you at all. So Calm is the best solution. That's why I said Calm is the best killer. It's the best killer to kill the top one killer and top two killer, which is the stress and the insomnia. Okay, the number three product is Vita. What is the benefit for Vita? Based on the name of the Vita is for vitality. Okay, there are three benefits for Vita. Number one, for immune system. For immune system, the best doctor in the world is not from US or from Japan. The best doctor in the world is from our own body. We call it immune system. We have a built-in best doctor, which is immune system. Based on the scientific study, 99% of the disease are caused by immune system disorder, except genetics or accident. So it means that there is no any disease which has no connection with immune system. Meaning to say, as long as you can take care of your immune system very well, your immune system can be the one who take care of you very well. Okay, so Vita is the best product to support immune system. Whenever you support your immune system very well, your immune system will support you very well. The second benefit of the Vita is for detoxification. For detoxification, okay, there are two body systems which in charge of the detoxification. Number one is the digestive system through by bowel movement. The second one is the urinary system through by urination. That is the two main way for detoxification. Agree? Yes, you have to agree. Whenever there is no urination, what's the problem? Dialysis, right? Right? Because it's the toxinemia, it's the uremia, right? The toxin, no more kidney. Kidney doesn't have function. That's why unable to get out the toxin out through by urination. That's why you have to rely on the gadget machine to get out the toxin instead of a kidney. We call it a dialysis, right? So at this moment, of course, that detoxification is very important to you. Then Vita is the best support to support your body system for detoxification. That's why you can see the testimony from our user who suffer from the bowel movement, like the constipation for a long time. Because of Vita, they are able to make poo-poo regularly now. For example, the frequency of urination or the difficulty of the frequency of the urination, the frequency of urination before, because of Vita, right now, they did not stand up in the midnight for urine anymore. Okay, that is for detoxification. The third benefit of the Vita is for micro blood circulation. Like what I mentioned a while ago when I talk about exercise, right? The importance of a cardiovascular system. Like what I emphasize or I explain all the time. The strongest organs in our body is liver. Not easy to destroy liver. So if you have a liver disorder, can you imagine how great you are? You are able to destroy the strongest organ in our body. The second strongest organs in our body is kidney. It's not easy to destroy kidney. Okay, but if you suffer from the kidney failure, can you imagine how great you are? You are able to destroy the second strongest organs in our body. Then the longest organs in our body is intestine. Okay, but the most important organs in our body is our heart, cardiovascular system. We can live without food for 7 days, for 1 month, but we cannot live without oxygen within 6 minutes. Can you imagine that? The main function of a cardiovascular is for nutrition and the oxygen. Whenever the cardiovascular is very poor, whenever our blood circulation is very poor, we will not be able to deliver the nutrition and the oxygen properly. Whenever our body cell, whenever our organs lacking of oxygen all the time, that is the way to destroy our organs. That's why all the disease is necessary. Especially for Chinese doctor. For the Chinese doctor, aside from the main ingredient for the main disease, we will give the sub-ingredient for 2 body systems. One is the digestive system. Another one is a cardiovascular system. For example, if the digestive system of a patient is not good, it's useless to you to give the main ingredient because they are unable to digest, they are unable to absorb it at all, or it's useless, sayang, right? So even digestive system is good, but the cardiovascular, the blood circulation is very poor. At this moment, unable to deliver the nutrition or the medication at all. So it's useless. That is the reason why, aside from the main ingredient for the main disease, we have to prescribe the sub-ingredient to enhance the digestive system and the cardiovascular. Can you imagine that? What I'm going to say is that, what I mean is that the importance of a cardiovascular. So regarding our response, our Vita is very good for blood circulation. When you put our Vita onto your body, you can increase the blood circulation by 30% within 10 minutes. 30% within 10 minutes. Of course, it's not exact 10 minutes. Okay, based on the study, based on the research we have, 10 minutes, you can see the improvement, 30% improvement. But for some people, of course, it's different. For some people, if their blood circulation is much more serious, you will not be able to see the improvement within 10 seconds, 10 minutes, maybe 30 minutes, maybe 3 hours, maybe 3 days after. But as long as you have a patient, then you can see the improvement. Okay, especially the person who suffer from the numbness, especially the person who suffer from the eye version, you can see the effect. You can see the effect because of blood circulation, especially like the eyes. It's the micro blood circulation, a joint part, micro blood circulation. As long as you can improve the blood circulation, the micro blood circulation, is the best way to improve your health condition. Okay, so those is the 3 products we have. Okay, so regarding our product, the most important is the safety. It's a safety. There is no any side effect. There is no any heavy metal. There is no any chemical at all. Okay, like what I say all the time. Okay, even you do not see the effect, at least you will not see side effect at all. Correct? If you do not see effect, what's the meaning? It means that this one is useless, right? But at least you will not see side effect. Because the moment you see side effect, that is too late all the time. Right? That's why safety is the best protection for everyone. That's why before to you to look for the most effective product, what you have to confirm is the safety all the time. Like what we mentioned in the beginning, right? The reason why so many people they are very careful to take the medication because what they are afraid is the side effect, right? So of course before you see the effect, you will see the side effect. So what kind of product you have? That's why the most important is the safety. So regarding the response of the Blessingswave, what we can guarantee is that no side effect at all, because 100% nature, no medicine, no pollution, no chemical, no heavy metal at all, no harm at all, even no needle. That's what we call is the acupuncture without needleness, right? So if there's a requirement, when you use the wristband, the only requirement is drink more water. Please drink more water, because water is the best conductor. Whenever you drink more water, at this moment, the wristband is more effective for you. Okay, so for those friends who did not see the effect, do not experience the effect yet, okay, maybe that is caused by the drinking water you have. It's really too few. So please drink more water. Whenever you drink more water, you can see the effect of our wristband. Okay, even you do not see the effect of our wristband, but drink more water is necessary. That is good for you. That's why I said that even you do not wear our wristband at all, you still have to drink more water. Water is very, very important. Especially do not drink water only whenever you feel thirsty. It's too late all the time. You need the regular drinking water. You have to follow the volume of the water you need every day, even you are not thirsty. Okay, especially for senior citizens, especially for those people have a cardiovascular problem. Okay, water is very important. Whenever you lack of the water, then the blood pressure is getting higher. Whenever lack of the water, then the blood become very sticky. Okay, then that is moment to you to see the stroke. Okay, especially early morning. Okay, especially early morning. That's why the early morning when you wake up, what you need is a warm water all the time. Okay, that is the product presentation of the Blessingswave tonight. Okay, so we are going to question and answer. But before we give a question and answer, I give you the basic question. Then I will give you the basic answer. The first question is the expiration. Okay, we don't want to call it expiration because the meaning of the expiration is that whenever after the date of the expiration is means expire. Expire. What's the meaning expire? It means spoil, it's damaged, it's harmful, right? Correct? Like the food, expire already, spoil already. Of course, it's very dangerous to you if you still take it, if you still eat it, right? That's why we call it expiration. Okay, so regarding the product of the Blessingswave wristband, we do not call it the expiration, we call it the duration. The duration is good for 1 year. The best timing to use our wristband is the first 1 year. But 1 year after, number one, it doesn't mean that it's useless. Okay. Second one, it doesn't mean that it's harmful 1 year after. Understand? That is the reason why we call it the best timing. We do not call it expiration because the definition of expiration is after the date it's really expired. It's harmful. It's dangerous, right? It's a spoil. But our wristband is not. Even 1 year after, the only difference is effect is not so good like the first 2 months. So at this moment, no need. Okay, whenever you buy the new one, no need to you to throw away the old one. Okay, because still have effect, but not so effective like the new one. So what you can do is that you can put the old wristband beside the bed where you sleep. Like come, right? Come. 1 year after, put under your pillow, right? Aside from the new one, put under your pillow. For example, like the Vita, right? You when you're after, you can put the old one, beside your gadget, like the laptop, desktop, your cell phone. For example, like mask, you can use mask together with your drinking water, right? Drinking water. Okay, that is the expiration. The second one is for those people who have so many complications or so many medication. So at this moment, it's okay to them to use our wristband whenever they're undergoing medication or even they have so many complications. Okay, the answer is no problem at all. Whatever you are doing, whatever you have, it's not complicated at all. No problem at all. Okay. For example, the person who have a pacemaker, no problem at all. Even the person have a mental implant, no problem at all. Even the person who have an organ in transplanting, no problem at all. Because there is no battery operation at all. There is no electricity. It's only quantum frequency, no electricity. Okay. Then when you see the you will see how good is our product, especially for those people who is very sensitive, right? For example, infant very sensitive. So whenever the infant gets sick, what you can get? Do you worry about that? Even somebody introduce the best nutrition supplement to you, are you afraid? Because it's an infant, a buntis also, right? So can you imagine that? Our wristband, even infant, even buntis, no problem at all, right? Then, like what I say, infant, like the buntis, whenever the buntis, the mom, the mother gets sick and the medication is necessary. But how about the baby? So at this moment, you have to choose you or choose the baby. So at this moment, if you do not follow medication, it's dangerous to mommy. If you follow the medication, it's dangerous to baby. So what you can do, right? So at this moment, do you see the power? Do you see the beauty of our wristband? Whenever you face on this kind of sensitive people, for example, the person who cannot swallow at all, even you have the best medication, even you have the best nutrition, as long as the person cannot swallow anymore. So what you can do? What you can do is only IV, only injection, right? So at this moment, can you imagine that? You can use the wristband. You can use the wristband. That is the reason when I mention these kind of three cases, you will notice how good is our product. When you see the very sensitive or very serious person, you will see how good is our product. Okay, another question is how many wristband? It's up to you. It's up to what you need. It's up to your pocket. As long as your pocket is deep enough, no problem at all, even 10, even 20. Okay, it's up to you. It's up to your condition. Then how about the combination? No problem at all. No problem at all. You can combine all the product together. But what we suggest is that, okay, just use the CAM whenever you are going to sleep. Okay, but do not use CAM while driving. Okay, do not use CAM while driving. Okay, CAM is not sleeping pill. We'll put you into sleep right away. No. Okay, CAM is not sleeping pill at all. It's not drug at all. Just only for relaxation, for relaxing. So while driving, what you have to do is pay more attention, not more relaxing. Correct? Right? So at this moment, that's why we suggest not to use CAM while driving. Okay, but it's okay with you. You still can use the CAM while driving, right? It's okay with you. Even max, you can use it when you sleep. No problem at all. Okay. So combination depend on what you need. Okay. But what we suggest is CAM for the nighttime and nighttime max, then for the daytime. Okay. But if you can mix it, no problem at all. Okay. That is regarding the common question. That is the answer for you tonight. Okay. So I'll go to the question and answer. I noticed so many texts. Okay, question and answer. Any question?
First, Doc, share us take up the PowerPoint, please. Thank you.
Yes.
Thank you very much.
Okay.
Thank you very much, Doc, for your presentation. Yes. Yeah, question, please.
Yes, question, please.
Uh,
Kuya Raymond will ask the question.
yes, I think boy Avar is raising his hand.
Raising.
His hands. Unmute, please. Unmute.
Yes, you can unmute.
My max,
Yeah.
the hologram was already faded. Look at it. Oh, there.
Ah.
does
Yeah, we
does
have
it
seen
in
that.
any way reduce its effectiveness?
Yeah, it's still effective, but it means that we really have seen that for some person, based on our experience, for some people who is the weaker or more sick, when they use this man, you will see the hologram fed already.
Yes.
For the healthy
Already,
people,
yeah.
for the healthy people, even 1 year after, you still can see it's still very beautiful, shiny. But for some people, the person who is weaker, what I can say is really consume the frequency energy there. That's why really fed already. Especially, it's our wristband. The sticker for the our hologram is sticker, not ordinary sticker at all. Okay, we call it the polymer. Okay, so not easy to see it. But if you see our sticker, for those people who is really weak and sick, when they put the sticker, all the printing on the sticker disappear, even become transparent. Yeah, we can see that. Yeah, really fast already.
But it is still effective, right?
It's still effective, but that's what I say, consume more already. Okay, so what I would suggest, if you want, based on the situation of your mom, okay, based on the condition of the wristband you show right now, what I would suggest is that if you want to see the better result, for your mom, better to you to change it once every 6 months.
Good.
Okay.
Yeah, have to change it once every 6 months.
Can
For the
Thank
mom.
you.
Can I ask, Sir Boy, what's the challenges of your mother?
Of your mother.
Yeah. What's the illness?
Come again, sir.
What are the challenges of your mom? What are the challenges? What does she have any ailments, disease?
No, I'm the one wearing it.
Oh,
you're-
see, he is the one wearing it.
Oh, sorry, that his
Yeah,
mom.
okay. Okay. Yeah.
I'm hyperactive. I always go to the gym like 3 times a week.
Oh, same with me. Yes,
You consume more. You consume more. You really consume
maybe
more.
you consume more.
So
But you also
is
go
that
to the clinic, right?
Me? No.
No, you don't. You don't. Okay.
are you just using Max?
Max.
Are you just
Yes.
using Max? Maybe you should also use Calm if you're hyperactive.
We cannot. You're breaking up. You're breaking up. We did not hear what you said.
Okay.
Yeah, it's okay. Yeah.
One.
Okay. Any other question?
Sir Rito, do you have any questions, Sir Rito?
No. The only thing is that my one for sports. I have not played golf yet, but I'm not even doing some. The buttons are like fading. It's fading, yeah. So you know the buttons
Again?
that is chrome buttons, they are fading.
Oh, they're feeding the
Yeah, that's the thing
The-
I'm worried because there are some customers or as they might see
Okay,
how come this
we can change the content.
we
We
can
can
change
change
that.
the button. We can change the button.
Okay.
Next time we will send more. We will send more because okay, the button we have is coating. It's a
Coated,
coating.
yeah.
Yeah, coating. Whenever you scratch it, when you touch it, of course, then it's the faded already. Okay.
Well,
So at
only
this
one so
moment,
far, Doc. Only one.
yeah, it is the convenient to them. It's convenient to them. And we can exchange. We can change it. Next time I will
Change the
send.
button.
I will send more to Canada. So at this moment, maybe for like some leaders, like the Crown Ambassador, okay, like the Goya Raymond, even in whoever, okay, we can
Okay.
send additional buttons for you. So whenever your customer have a complaint about the button, then you
Okay.
can exchange with, you can change it. Can change it.
Yeah,
It's
I
free.
can. There's no problem.
Yeah.
I can do that.
Yeah.
Thank you.
Okay. Okay. Thank you. Thank you.
Thanks.
Okay.
Thank
Next.
Next question.
What is that button?
The button. The button, like this.
The button. Yeah, here. This one. This one. The button.
This one.
The button. Yeah.
Like
The
this.
button.
Ah,
Right
The
here.
button.
Here.
Yeah. The button. Yeah. Yeah. Yeah.
Yeah.
Mine is fed already. Also. Yeah. Mine is fed
Okay.
already.
I do not know if we could see it. This one. Yes,
Yeah.
that one. Yeah. Actually, mine is also 1 year, but up to now, it's still okay.
Okay.
So it's the button is replaceable.
Yeah.
Yes.
Yeah, if it's broken or it's really too ugly, if you don't like it, yeah, we can, whenever button is available, then you can change. Yeah,
Mine,
you can
mine
change.
is strong. Strong. It's still
Yeah,
strong.
mine also. Yes, mine also.
This
is 1 year already.
Very beautiful.
Mhm.
Actually, more
Doc,
than a year.
I have a question, Doc.
Yes.
I
Yes.
can your question actually. First, Doc, if a person has a pacemaker and has a double, is that artificial bulb on the heart? Like,
Mm.
would it be safe to use it?
Artificial heart.
Bulb,
Valve.
Like-
Okay.
Like the
Yeah.
Bulb.
you know,
valve.
the heart has
Valve.
bulb, right? To pump, I think. I'm not sure.
Yes.
Yes. Mm.
So is it safe to use to recommend the
My
Blessingswave?
answer is for this person, need more.
or need more?
Mm.
So
Which
really,
one?
This person
Which more? The three, meaning the
In a
Supermax,
particular,
the raw,
Can be more vital, more vital,
more vital.
more vital.
More vital. Oh,
Don't worry, vital will be available soon. Yeah, within 1
vital
week,
to
2
put it
weeks.
here in
And
the
this time,
near the heart.
this time we request so many vital. Okay, instead of come.
Mhm.
Then
So,
next time we're lucky, we're out of
Come.
so many vital.
Yeah,
Yes.
that's what I thought
Vital.
because one of my prospect has a valve for his heart, and then he got also a pacer right now, and he's admitted right now for another procedure, doc, for his heart. And he told me we used to work together, and then he said he's an engineer, and then he said it might affect my valve because my doctor tells me don't use anything, blah blah blah. And I said, well, this blessing waves don't have any battery like what you got in your pacer and your bulb. So so is it safe? But I will ask my internal medicine doctor about this also. Just want to get some feedback
Okay.
about this.
I will give you the suggestion. Okay, I
Okay.
will give you the suggestion. When I was in the hospital,
Okay.
honestly, there are so many people want to recruit doctor to prescribe their supplement.
Mhm.
Then always make excuse. Okay, then go to your clinic to ask this one. Can I take this one? Can I take this one? Can I take this one? Especially patient, bring so many things to ask you. Can I take this one? Can I take this one? So at this moment, the standard answer from medical doctor is no all the time. Why no all the time? Number one, we have no time to study what you are talking about. How I can give you yes or no.
Yeah.
Right?
Yeah.
Right? Second one, I really do not know it. Why I will recommend you. Correct?
Recommend.
That's why I
Yeah.
always say no. Just follow what we are saying. That's it.
Mhm.
That is a standard answer. So at this moment, when some user, okay, I will win the Brisbane, I will consult, I ask my doctor first. Okay, go ahead, but I can give you answer. I can give you answer because that is my answer before for the patient. No. Okay. Okay. So that's why in the beginning of my presentation, I always said that is your own business. You are
Yeah.
the only one who can take care of yourself. Nobody at all. Right? Whenever I say no, but it's a good product to them, that is their loss, not my loss at all. Correct? It's not my business.
Yes.
It's not my business. I'm sorry to say that. That's why better to them to identify by themselves, right? And that's what I said a while ago. Okay, the first requirement of any product, whatever you are going to use, is a safety. Safety is the most important. Okay, so regarding the product of the Blessingswave, it's really safety. Nothing at all. No chemical, whatever. That is the part we really can guarantee and the promise. No side effect, no complication. Whoever can use. Yeah, even like we said that the pacemaker, whatever. Yeah. And the reason why the answer I give to Goya Raymond, right? Do you remember Goya Raymond? My answer for
Yes.
you is more. What's the
That's
meaning
much
is
better.
more? Number one, the first meaning is it's not complicated at all. Whatever you has, whatever he has. Okay, so that's why no problem at all. The second one, based on his health condition, based on what you explained, right? His condition, he really need more for cardiovascular. Otherwise, they told he need more and more. Okay, need another surgery, another surgery.
Another valve. Change another valve.
Yes. Yeah.
Mhm.
Need a bypass.
Any more
need a whatever.
questions? Any more
Thank
questions?
you, Doc.
Because that is very
Especially-
basic cardiovascular disease already. Very basic.
Yeah, any more questions, especially for those newcomers? For your invites, you may ask them if maybe they are shy to ask the question.
Maybe I'll see if Madam Fee is still there. Are you still there, Madam Fee? She's
I did not see
invited.
her earlier. Yeah,
She was there.
by Arlene.
Oh, Arlene, is Fee there?
Yes, Arlene is still here.
Yeah,
Yes.
is
I think
Fee,
he's still here.
Yeah,
Fee there?
question.
Okay. Can
How is
I
she?
talk to Fee, please? Please, Fee.
Hello.
Come on, hurry up.
Hello.
Okay. Yeah, I just want to ask you, how were you introduced to Blessingswave?
Binisaya.
Kano sa man ka nakagamit og Blessingswave hasta ngano? Bakit? Why?
2 weeks na po.
2 weeks na. Ngano man?
Yes. Kasi nag-cramps yung ano ko dito, yung right hand ko.
Man?
Right hand nag-cramp.
Oh, yeah. Man.
Cramps. Oh.
Yeah.
Then when she wear the red
Max, the Super Max.
wristband.
Say
Superman.
Faye, Millet, please let Faye talk, please.
Sige, sige.
Faye, please.
Sige.
Oman, unsay nahitabo?
Pre, ayaw ko ulaw.
Gikan
Na-minimize na po ang yung crumbs. And I use this.
after how many days mo paggamit ang effect?
2 weeks na po.
Yes, paggamit nimo unsa nag-effect dayon? How many days after nimo nagamit?
It takes 1 week po. Yung na-observe
Okay.
ko.
Okay. So how do I say it? So I have to ask something, but anyway, thank you very much for sharing. How is Arlene?
Basta si
Ayun daw. Okay, go dito.
Okay na?
Nara,
Makalakaw ka
nara.
na?
Napindot na.
Oh, great. Unsa man imong health challenge? Unsa man ngano naggamit
Cutting out dito,
Crystal.
cutting out.
Cutting out ang boses?
Apat po ang ginamit ko.
Calm, super, at saka vital. At saka yung pink.
Think
Vital,
ang old
vital.
na vital, yeah, vital na.
Vital.
Yeah.
ka ba?
So unsa may imong health problem, health challenges nga nigamit man ka?
Health observation ba rin yun?
Ang health ngano nigamit man ka?
Oh, let's go.
Mild stroke.
Mild stroke, okay. Yeah. So
Karon,
after 1 week paggamit nimo unsa may nahitabo, unsa may result?
Correct.
Nakabangon ka na after 1 week.
Pindog lang.
Nakatindog lang. Kabango na.
Oh,
Tapaw
okay,
na.
good. Okay, good. Thank you very much. Thanks, God. Okay. So anyway, Arlene is our niece, the daughter of our cousin, mother's side. So Kuya Roger was able to introduce her. Nakita niya na she was not doing well. So anyway, just a bit of sharing. Thank you very much, Arlene and Faith, for sharing.
Yeah, thank you
Back to
very
you,
much.
Pastor.
Yeah, thank you for your sharing. Yeah, thank you very much. Okay. Yeah, so keep on using it. Okay, that's what we say. Our wristband is the 24/7 pocket doctor. Okay,
Doctor.
regarding there is a question on Sunday, but I was unable to answer. Okay, regarding the how many hours you have to wear wristband, correct?
Yes.
Oh, yeah,
Yes,
Remo?
yes.
Yes,
There's a
yes,
different
yeah.
question.
Mm.
Okay, my answer is that do you remember we said that the therapy behind quantum medicine we call it a bioresonance therapy. There is a one key word which is the
Bioresonance
resonance.
therapy.
Yes. Okay. The key word is a resonance. Resonance. What is a resonance? The same as the music you are listening, you are hearing. Whenever you hear longer time, you will be able to memorize the whole song. Understand? Our body have a memory. So at this moment, the
Yeah.
resonance, if you want to make the specific or correct frequencies more stable, at this moment, you need longer time for resonance. Whenever time is longer, the power of a resonance is stronger and more stable. Okay. Another one is that remember one character of the resonance is the accumulation of energy. Accumulation. Accumulation. Resonance is accumulation. I give you one example, you will understand. Swing. Swing. Swing.
Yes.
You know swing? Right?
Swing.
We play
Like
it
in
when we were
the
younger.
playground.
Swing. right?
Like
The
ipinjury.
playground, the
Playground.
swing. In the right, do you notice that what we move is the same, but when we keep on it's moving, later on we can make it higher. We can make it higher. We can make it higher. Even we can go around already. Where's the energy from? The energy you spend is the same, moving, moving, moving. But why? How come getting higher, getting higher, getting higher, getting higher, getting higher? Even the moment you can going around. Where's the energy from?
Accumulation.
That is the energy from the accumulation of the resonance. Because
Resonance.
that is a resonance, resonance, resonance. That's why there's accumulation of the energy. That's why getting bigger, bigger, bigger. That's why if you use the resonance product, whenever you use it stronger, the power is more powerful.
Mhm.
That is the reason why we always 24/7. We call it a 24/7. Longer is much better because of the resonance. That is caused by the character of the resonance. Okay? Any?
Thank you, Doc.
Thank
Okay,
you.
you are
About
ready.
yeah, yeah. I will just want to call on iPad. iPad, are
Not
you
me,
there?
not
See,
me.
no, no, no.
I'm iPad Pro.
iPad.
iPad Pro.
Me also iPad. No, what my iPad is BWMB.
iPad now.
Is the
There's
iPad?
our iPad, Miss Lita Carbonell. Are you listening po? Do you have
Yeah, you
any
can
question?
unmute. You can
Actually,
unmute your
she
microphone.
attended last Sunday. She was also there
Yes,
last
I-
Sunday personally
Yeah.
with Dr. Marilyn. Yes. Hi, good evening po.
Hi, good evening.
Good evening po. Yes.
Good
Do you have
evening.
any question?
I would like to I want what's this? I want to ask a question, no?
Good.
Because my husband had a stroke 12 years ago. But he's
Mhm.
okay. Oo, okay naman siya. Kaya lang, weak na yung legs niya. I mean, he can walk, kaya lang because of that, parang nag-slow ang
Movement.
lakad niya.
Movement.
Lakad niya. Oo.
Mhm.
So, what bracelet can I get for him?
Okay.
Stroke
Your
patient.
question is
For 12 years.
yeah,
For
I
12
know.
years.
How young he is?
He's 89. He's
89.
89.
Okay. Okay.
So
So,
deduct 12.
regarding
Yes.
I
Yes,
don't know
Kuya
how to call
Rito.
that.
Or a Max,
Yep.
Very
Kuya Rito.
important.
The red one. Yes.
Oo,
Yes,
I
Kuya
think
Rito,
the red
correct.
one, no? And the red
Yes,
one
the red.
and the blue one.
Vital.
Okay.
And the vital
Yes.
po.
If he is not so big, okay, if he is not so big, at this moment he can use Max as the ankle band.
He's not
Okay.
big.
But if
Is
he
he
is so
thin po?
big,
Is he thin? Is he
He's
thin?
not big. Medium size. He's
Medium.
not big.
Okay.
so I think I need a Vita ankle band,
Max.
the blue one. Yeah.
The blue.
So at this moment, especially you wear our wristband, either Max or Vita in the side of the weaker side. What you say is the left leg, right? Left leg is weaker. Okay. So at this moment, you can wear more in the left leg. Yeah, to
So-
help him.
So he's going to
yeah.
wear it on the leg, not the arm.
The weaker
Leg.
side. Okay, because what you say is a stroke. So if the left leg is weak, I believe that his left hand is affected also. Maybe it's not so serious like
No,
the leg,
it's,
but it's the same.
it was not affected. Only
Yeah, a little bit. Yeah, compared to.
weak lang.
Yeah. Anyway, regarding is a stroke. Okay, depend on which side. If it's the left, then left hand or left leg. Okay, and the reason why I have to emphasize leg, because whenever the left leg is very weak, it's dangerous to him also. It's dangerous to him. Whenever he stand up, whenever he went to CR or whatever,
Oh,
it's
yeah.
dangerous, especially 89 years old already. So at
Yeah.
this moment, for the senior citizen, the way to stronger the lower part is very important. The way to stronger the lower part. That is
The
what
low-
we have to avoid. That is the way.
Yes.
That
For
is
all of
what
us
we have to
also.
avoid all the time. Yeah,
Correct.
have to avoid.
For-
That is the reason why I suggest that for him, if it's okay with him, even two ankle band in one side is okay. To stronger the left side. Yeah. At the same time, aside from the energy he will get, it's good for the blood circulation. Especially
Correct.
he was the stroke patient. It
Yeah.
means that he have a cardiovascular problem, either the
Yes,
clotting
yes.
or whatever.
Yes.
Right? So that's why cardiovascular is more important to him. So it means that our response is hitting two birds to him. One is for the from the stroke before. Another one is for the cause of the stroke before, which is the blood
Yes.
circulation. Yeah.
So, what place will my husband? Where will he place the other one? I mean, I get
Wristband
that.
po. Sa hand.
get-
Sa hand. Sa
Sa
hand
hand.
po.
It's
Yes.
here. Sa hand.
The other
And
one
the
is on
other
the
one,
legs. As
sa
the
lower
ankle.
leg.
Ankle band. Ankle band.
Oh, I see.
Ankle band. And the other
Yes.
one is the wristband. Yes.
Okay.
Yes.
Especially more
Yes.
on the left side.
More on left. More on
More,
left.
more on left.
Yes.
Yeah.
Ah,
Yeah,
more
for more energy.
Left.
left,
Yes. Apo.
left leg,
Apo. Left.
the left,
Left
leg.
leg and left hand.
Left leg and left hand. Oo, kasi ang heart,
Yes.
nasa left. Oo.
Correct.
Yes. 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 Okay.
Another question.
Yes.
I have,
Okay. Sige pa.
I have knee pains because of my osteoarthritis.
You have what po?
Mm.
You do.
Osteoarthritis.
You
Yes.
have osteoarthritis.
Yes, because
Yes.
of my age, maybe, because I'm already
Yes.
86.
Yes.
Apo.
So, what bracelet could I get?
Wristband. What wristband?
Yeah.
Let me think for a while, because osteoarthritis. When you
Yes.
talk about the osteoarthritis, number one is arthritis. So it means that what you are talking about is the discomfort caused by arthritis.
Yes.
The second one, of course, osteoarthritis. And the osteoarthritis is caused by aging. Based
Aging.
on your age, 86 years old, okay,
Oh.
is necessary already. So there is no any way for anti-aging at all. So at this moment, what you can do for the aging arthritis is number one for the joint pain. Okay, when you walk, it's painful, then it's for pain. The second one is for the weakness caused by the arthritis. Okay,
Yes.
so at this moment, regarding the osteoarthritis, what you are talking about is a joint part, right? Joint, leg.
Joint pain. Yeah. Both legs.
Okay.
Joint pain.
Vita. Two leg.
I'm taking this supplement, which is what's this? Glucosamine chondroitin supplement for the cartilages and the bone.
Yes, yes.
That's what I'm taking every day.
Yes.
It lessens the pain. It lessens the pain.
Yes. Yes. Yeah, can.
Yes.
Can. Yeah. Can. Combination, like the Dr. Marilyn said always, our wristband is one of the best product, not the only best product, one of the best product.
Yeah,
so
combination.
aside from our wristband, if you have the very good supplement, what I can say is keep on using it and congratulations. Right? Just like what I said today, lifestyle is the main cause of a disease. Lifestyle is the main cause of a disease. Okay, So at this moment, if you can avoid to carry something, right? Avoid to carry something based on your age, based on osteoarthritis, it's not good to you to carry anything at all, right? So that is a part of the lifestyle. That is what I can suggest. Okay. Then what I suggest, you really have to stronger your leg. Yeah, based on your age, 2 legs is very important. 2 legs is very important. Have to stronger it.
Yeah.
Yeah. Okay. Yes.
Okay.
Okay.
Kuya Raymond. Okay. Yes, po.
So
Yeah.
what
There's
what
other- okay, go ahead.
bracelet? Excuse me. What bracelet will I get?
Vital po.
You
Vital.
Vital.
Vita. 2 Vita. 1
2
leg
Vital.
each.
Vita, what is that? The blue one or the
Blue one. Blue one.
Yes,
Blue
po.
one. Left
The
and
blue
right.
one.
Yeah, blue and right.
I have to wear
Okay.
it where? Sa leg? Yeah, ankle.
Yes.
No?
Leg.
Ankle.
Yes.
Mm,
And
yeah.
the same time, because it's an ankle leg, whenever you experience the joint pain, you can move the ankle band up to your joint part. You can move
Yes.
to the near area.
Yeah. Oh,
Yes,
I
like the
can
knee.
I can
Yes,
move
or
it
the
to the knee. Yeah, the knee.
yes,
Yes.
Opo.
Yes. 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 We call it an ouch point. Ouch point is the put on the point. You feel ouch. That's what we call it an ouch point.
And another question, can I use it even in my sleep?
Yes.
Yes. Opo.
Yes.
Yes. 24 hours you can.
24/7.
24 hours. Okay.
Yes, 24/7.
But if you're
Yeah.
uncomfortable when you are taking a bath or taking a shower, you can take it off. Then
I-
just put it back after your
After.
shower.
Okay.
After your shower, yes. If you're uncomfortable.
Yes.
If you are comfortable wearing it while on the shower, you can also use
It's
it.
okay.
Just wipe it. Wipe it also, same as you wipe your body. You let it dry, then you can wear it again.
No, it's
Yes.
better to take it off.
Yes.
better to take
Yeah,
it
I don't like
You don't
taking
like
a bath
getting
with too
wet.
many in the body.
Oh, yeah.
Yes, po.
Okay,
All
thank
right.
you. Thank you very
Yeah,
much.
Thank
me
you
too.
po,
Me too. When I
Ma'am
take a bath,
Lita.
when I take a bath, I really take off.
Ouch.
Of course, you have to take off. Okay.
Ami, mag-ballroom ka din.
Mag-ballroom. Of course, you have to take off. Kuya Raymond has a question. Yes, Kuya Raymond.
Yes, if there's, I would like to address this question to Madam Josie Bacolod.
Yes,
that okay?
kay Miss J. Yes, yes.
Yeah. So I understand you were the one who sent us the little girl with epilepsy.
Yes,
Oh,
with the
yeah.
epilepsy.
Epilepsy.
Yes. It came
Yeah.
from Bacolod. It is from Bacolod.
Yeah.
Yes.
I have few questions because in the video we didn't heard whether she's taking medication during the first 5 years of her epilepsy episode. And then the second question, or we would like to know if during when she was using the wristband where she was not having or she is not having attack of epilepsy, is she still taking
Seizures.
her medication or seizure? Yes. And how is she doing now? That's the three.
Yeah, I think
things.
we could. I think we could ask that one by one.
Yes.
Yeah, because Kuya Dr. Rene also asked those questions last Sunday. So I think number one is how did it happen? Does she have a disease? Does she have an illness? Does the doctor was ever diagnosed her? What happened to her?
Or if she fell when she was dropping.
Yeah, or she
was a
fell.
baby. That's one.
Yeah.
That's one.
Yeah, question
of the
by
question.
one question by
One
one
by
question.
one question. Yeah.
Yes. Okay.
Excuse me.
Okay.
Can I leave now?
Thank you.
Can I
Yeah,
leave
sure,
now?
sure, sure.
Excuse me.
Yes,
Yes
yes,
po, yes
sure,
po,
sure,
yes.
Thank
sure.
It's
you.
Yeah.
your
Good
bedtime
Thank you,
night.
class.
thank you, thank
Good
you. Good
night,
night.
sir. Good night,
Good
good
Night.
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 Thank you for
Yeah.
Night,
joining. Thank you for. If you have
Okay.
any
Thank you.
question, you just ask Miss J po.
Okay.
Thank
Thank
you,
Okay,
you.
thank you,
thank you.
Tita.
Thank
Tita
you.
Nita,
Bye-bye.
thank you.
Thank you.
Okay.
Bye, Tita.
Do I
Yeah.
close
So,
this?
okay. Good
Apa.
evening to everyone. Yeah. Okay na, ma'am?
Ah,
Yes,
yes,
yes.
yes, we could hear you. We could hear you. Yes.
Yes, we can
Yes.
hear.
Okay, good evening to everyone. Regarding the
Good
case of
evening.
Shaira, yes, regarding the case of Shaira, she's a 9-year-old daughter of my friend. Actually,
Mm-mm.
actually, she's taking medication already, ma'am. At the time that I gave her the wristband and let her try the wristband, she's taking medication already, and she's now probably taking for 5 years, for 5 years already. And that time when I let her wear the wristband, we just note she noticed that there's pinching and like that, and she don't have the attack, you know, she don't have seizure. But when she take this off the wristband, she will have the attack. So I tried to observe her for more than a month already, and that's the last video that I sent to Joey. That it really works to her, the wristband, because she don't have attack at all when she wear the wristband. And
So,
regarding the previous history, that's the time I think I have to ask her mom if she had an accident or what, bump, that bump her head or
Yes,
whatever. Yeah,
yes.
but she's taking the medication already, so far as I know.
so
Yeah, for
okay,
the epilepsy. Yeah, for her
okay.
epilepsy.
For epilepsy medication, so you don't
Epilepsy.
know whether what kind of medication she's taking.
Yeah, that's what I'm going to go to their house tomorrow to find
Oh,
out what medication does their doctor prescribed to her, and also the history, as what Dr.
okay.
Rene asked me last time. So that is my assignment.
Yes.
Another thing,
But
Mm.
yeah.
yes. Uh, uh, another thing, is she taking medication during or while she was or she is using the wristband?
Yeah, I
Every
think
time
she
she
still
use.
continue. I think she still
She's still
continue.
taking, she's still
Yes,
taking medication. Okay.
I think so, because
And
once she take this off, she has
no,
seizure.
no,
She has an attack of
no,
2 to 5 times in a day.
no. My
Okay, I think
question
I
is
think I think the when she was not yet wearing it, so even if she's taking the medication for the seizures, she still gets two to how
Five,
many?
two to
Two to
2 to
five
5.
two
attacks
to
in a
five
day.
times a day,
Yeah, because
even with the medications.
yes, yes.
Oh, okay.
Because when
So
I
it means
arrived there,
that
Wow,
yeah,
lupit, no?
when I arrived there,
yeah,
when I
lupit,
arrived
di
there,
ba? Yeah.
Okay,
So it means
Galing,
that
galing.
when she
when she used the wristband and then she's still taking the medications, of course we cannot tell them not to take the medications,
yes,
but she no longer had any seizures. Only
yes,
when
that's
she's taking it
correct.
off,
Yes,
then that's the time that she will have seizures.
okay,
So the
yes,
only difference is the with and without,
yes,
but all
yes,
factors are still there.
yes,
yes.
All factors
Wow,
are still there.
Mamaricom.
She still continue the medications. She still whatever she's doing, she's still doing all the same factors. The only thing is that with or without the wristband.
yeah.
Wow, that's a very
What's
very
the
nice
wristband? What's the wristband?
comparison.
I actually let her wear, we try her first the red. And then later on,
Ma
what I really let her wear is the calm, because she's
Calm.
like hyper also. She's a hyper kid. So
Yes.
the mother told me whenever she's feeling hyper, she had that sudden attack. So she just have that attack right away, the seizure. So I gave her the calm, to relax her.
Okay, that's good.
By the time
Yes,
she
to
wears
relax
this,
her.
she said, "Oh, I feel so sleepy." So she really have a deep sleep on the sofa.
Mm,
at that time.
Wow.
She was
Mm.
scripted.
mm.
That's what she really needs because she's hyperactive already.
Yes,
So
that's
what
what-
she cannot have the red
Yes.
anymore.
Not
Yeah.
in the red.
Yes. If I'm the
Yes.
one, I will suggest calm directly.
Yes, calm. Yes, to calm
Based
her
on the
nerves.
based on
Her nerves.
the
Yeah.
understanding of
Mm-mm.
epilepsy.
Epilepsy, yeah,
Yeah.
the
Hey,
nerves.
Mom,
Yes.
I'd like to try more case about that so that I can try another patient with
But she's
epilepsy
only
also.
wearing one, right?
Galing, no?
She's wearing one. Actually. Yes, she's wearing one. But her mom, since her mom is also high blood with 200 something over 100 like that, the blood pressure.
Uh-huh.
So
Wow,
she
walking time bomb.
now, yes, walking time. She's now wearing
Walking
the
time
white,
bomb.
but she usually put the white also to her daughter. So two
Ah, it's
wristbands
okay,
she wears. Yeah, she usually wears the two wristband, the white and
The
calm.
vital
Yes.
and the calm. Ah, okay.
And later
Wow.
on, I will
Wow,
invite
very
her to come over to the office to do the
yes.
actual testimony with our, you know, when we do the
Testimonials. Yes,
face-to-face,
yes,
yeah.
yes,
When
yeah,
we do the
yeah.
face-to-face orientation there. Yes, ma'am.
Wow. Yes,
Can
Kuya
I
That's
have
Raymond,
why
please go
I
ahead.
last question
always
for
say that.
Madam
Very
Josie?
nice.
Yes, Kuya Raymond.
Yeah.
Mm-mm.
If you know
Uh,
how difficult to cure disease, you will know how good product is.
Yes.
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 Yes,
You
very
know,
true.
sometimes you think that it's really necessary to doctors to solve any disease, whatever you have. No. Even when the doctor is the one who suffer from the same disease, they will not be able to cure by themselves for
Yes.
themselves.
But Claire, we always have to
Understand?
remember, like what
So
Dr.
yes,
Marilyn said, it's the more the better, and it's not complicated. You know, you can drink your vitamins and supplements, and you can wear it also. You can drink your
yeah,
medication and wear it also. So
yeah, you can
no
interview
harm.
more family or
Mm-mm.
more people who suffer from epilepsy.
Mm-mm.
You will know
Yes.
how difficult
Yes,
epilepsy.
yes,
Epilepsy.
yes. Because
God,
supposedly they will
Actually,
I can
outgrow that when they're
even I
7
can
years
give
there's no
old.
medicine on that.
even I can give you
No?
one cause of epilepsy. I can give you one cause of epilepsy. One cause of epilepsy is unknown. If the answer is unknown,
Yes.
what is the
Correct,
solution?
correct.
Yes, correct. How
In
will you
medicine,
solve?
doctor,
Yes,
they
doc.
call
Yeah,
it idiopathic.
Yes.
yes.
Oh, yes.
Means
Correct,
they don't
Dr.
know.
Yes,
They just
idiopathic.
make it
They need
scientific
problem.
words.
Yes,
That's
yes,
why
that's
even
true.
this little girl, okay, I'm sorry to say that, even this little girl is the only one case in Blessingswave. That is good enough. That is a blessing to her.
Oh my
It's
gosh,
okay.
she's only 9 years
Correct?
old. There's so much blessings to her.
Correct?
Yes.
Yeah.
Yeah,
Yes.
it's a blessing to
That's
Yes,
her.
very,
yes.
I'm
the
only 9 years
that's
old.
only 9-year-old. Gosh, you know, she
Yes.
still have, you know, her own life, her whole life ahead of her.
That's a lifetime. And
Yes, that's a lifetime already. She passed through already the 7-year-old there.
Grabe.
So it means
No.
it's lifetime already.
Yes.
Bit-bit
Yeah.
na niya yan
Yes, Kuya
forever.
Raymond. I think Kuya Raymond has
Last
a
question.
question.
Last
Yes.
question for Ma'am Josie. Was there a follow-up from her doctor, like
for neurologist.
after
Neuro.
using the wristband? And what does the doctor say, if any?
Yeah, that's why I have to go to their house tomorrow to find out all the details so that I can give it to you. The history,
you.
Mm.
how she got that, and
Thank
the
you.
one that
Thank you
you
very
asked
much.
me today. Yes.
Yeah. Thank you very much, Madam Josie.
Thank you so
very
much.
Thank you. Thank you also.
I think
Dr.
it
Raymond.
gives
Power.
us, not only me,
Right?
for
Right,
everyone
sir.
that
Galing.
Right?
really working.
Yes.
It's not
Actually,
joke.
Actually, we have already one user, one of my downline, but I don't want to mention because this guy is already still in the active military service, and he is general right now, repairable. He has that the same issue. Okay, but he doesn't want to mention. Ayaw niya magpabanggit kasi kilalang kilala. But well,
Privacy.
yeah, may tama din, nag-epilepsy siya eh. Di ko alam bakit pumasa sa ano yan, military. Di ba ba't pumasa siya? Now, ang usapan lang namin is the red ang suit niya kasi pangkalakas si Brownie, di ba? You know, the military people, they want to, you know, to become the real man. But I don't know that he has this kind of problem also. But may mga atake-atake na siya. Minsan nagpa-pass out siya, drop out siya. But still, hindi siya dinischarge sa, sa service. But 1 year na, no? 1 year, hindi na siya inatake. But hindi niya mininsa sa akin yan. Basta 1 year, hindi na siya inatake. Yun lang ang sinasabi niya sa akin. But tinanong ko siya, meron ka bang mga gamot yan? Brad ko kasi sa frat eh. Sabi niya, wala. Meron siyang pinainom sa doctor. Vitamins lang daw yun. But actually, sabi niya, wala daw gamot. Ni-research na daw niya yan. So,
Wala. There's
Anong
none.
binigay mong wristband, Sir Lister?
actually, doktora pula eh. Kasi ang usapan namin, binilt niya yung, I think, 5 pula lahat ang unang mga pinagbibili niya. So, siyempre, ang
Pampalakas.
kalukuhan lang namin, bisa magsuot ka nito, you have the energy. Meron naman daw. Baka mindsetting na lang, no? Na mindset ko ng gusto. So, but the other thing na hindi niya binanggit, nakaraan, nagme-meeting kami dahil nga sa mga biroan namin doon sa gera-gera dyan sa Ukraine at saka sa Kasi every once a week, may tapok-tapok kami ng mga brad ko. Mga minsan binibintahan ko na lang, di ba? Sinabi niya sa akin, ibang klase itong ang tawag namin ito, anting-anting. Anting-anting ang tawag namin itong Because these people don't really believe. I just, buy it from them because I need money. Ginaganon ko na lang. Binibili lang kasi ako yung mga parang lower class sa kanila. Kumbaga, ako yung mababa ngayon kasi dati ako yung nagpapainom. Ibig sabihin, ako yung pera. Yung malakas pa yung kumpanya ko, mga negosyo ko. Ngayon, we're just starting here. Binibinta-bintahan ko na lang sila. And they're buying. But, binibiro ko na lang kasi pag-discussan ko ng mga ganito, quantum. Ano naman yan, bro? Dati, pendant, no? Anting-anting uli sa ganyan. Tapos ngayon na naman, wristband na. Dati yung, have you heard of Fusion Excel? Ang lakas bumili na sa akin, may tag-15 mil yung isa. So they're buying that. But out of science, wala talagang alam. So ang tawag nga namin lang yan, anting-anting. No? Out of, na context. But napapansin niya, wala na siyang atake. No? Kaya nga pangalawa na to, regarding with the yung increase of testosterone, medyo meron daw. Kaso lang may edad na no. 62 years old na, retirable na. Magre-retire this year yan. So, yun lang kaya nga nagka-confirm ito si Madam Josie ko, wow. Tama yung sinabi mo, Madam Josie, na lifetime mo ng bit-bit yan. No?
Yes.
Lifetime na yung sakit bit-bit yan. Kaya nakakaawa din.
Epilepsy.
There are so many times that he was subject for i-terminate sa service dahil nga may siya karamdaman. But then na-justify naman, ewan ko lang kasi Mayor, ewan ko paano pumasa sa training to. So he just bought 5 max, puro max, pinelt lang niya lahat yun. So because ang usapan namin palalakasin nga yung niya, testosterone niya para stamina daw. Okay? But binulong niya sa akin nung lakas pa uminom, nag-try kami ng nagchat-chat. Sabi niya, Brad, hindi na ako na Hindi ko rin alam na meron pala siyang ganyan. Sabi niya, inatake lang siya ng high blood o ganyan. So ngayon, na-confirm, Madam Josie, no? Sa mga leaders po nandito, guys, could you imagine this wristband which we have right now is the solution of the gap of the medicine? Diba?
Yes.
Kasi lang, kailangan natin talaga i-educate. Dapat sana, pag Monday, pupunuin natin itong Zoom. Request ko lang. Sana punuin natin itong Zoom. Sayang, Diba? Andyan yung mga professional natin, mga
Validate
tao.
nila yung mga testimonials na ganyan. And they can ask the
Pag ako
questions
mag-present,
right
wala
away.
talagang maniwala kasi marketing plan kagad ako diba? Kitaan kagad. Pero the science behind this product, diba? Hindi talaga maniwala sa akin yan because I'm not even a medical person, diba? But guys, mga leaders, please it's not all about the money that we earn right now. Of course, nandyan naman yan Yung matulungan sila, diba? So, you are making truly a difference there. Di nyo ba alam yan? Yun na lang sinabi nating sakit na karir na. Yung epileptic na yan. Karir na yan That kid, pwede siyang mamatay anytime di ba? Pwede siyang atakin anytime. Katulad ng hika. Pag inatake ng hika, pag walang oxygen yan, diretso yan. Simple lang. Pero career na sa bit-bit na. And here we are, a new revolutionary product, di ba? Revolutionary to ha, and then we are already positioning. Hindi pa to nagte-trending. At trendingin natin to, guys. Nasa kamay na natin. Huwag tayong mahiya. Pag wala tayong alam, may mga professional. Bit-bitin na natin every Monday dito. Every Sunday.
Learn.
Di ba?
Learn. Very easy lang
Learn.
naman siya. It's not as,
I-
you know, that we have to be
I-
all PhDs and MDs to
I have another
be able to
question.
understand.
Kasi ako,
Kaya
ano lang
ano,
ako MD, PhD. Mukhang doktor pero hindi talaga.
Yun nga.
Pareho lang tayo.
We don't need to be MD, PhD, no. We don't need it. It's just very simple. It's very simple. And enlightening them here every Monday, it's the most simplest thing. So many people will answer your questions. There is a question from Emmanuel Sumalde. Yes po. You are raising your hand.
Yes po. Magandang gabi.
Emanuela pala.
Opo. May
Ay,
tanong
yes
lang po.
Yes
Kung
po.
may diabetic po, anong pwedeng ipasuot na wristband?
Diabetic.
Opo.
For diabetic people. You can mute, Doc.
I forgot. Okay. Regarding diabetes, what I suggest at least Vita and Calm. I think that you know diabetes better than me. Number one, for those the most of the diabetes patients, they suffer from insomnia at the same time. That is caused by nerve disorder. Nerve disorder, even the body pain, back pain from head to back. Okay, so that's what I suggest is Calm. And aside from that, of course, another risk of diabetes is the blood circulation, heart complication. That's why Vita is really necessary. So as long as you use the Vita and Calm, then you can observe the sugar level later on, step by step. Okay, what I'm talking about is for the complication first, for the diabetes.
Yes.
Calm and the Vita. And the same as what we say, how many respond? More is much better. More is much better, then it's up to you. Yeah, okay?
What do you mean po more? Maraming isusuot na ganun, vital band, wristband?
Yeah, more. The meaning more is much better is that, for example, what I say a while ago is Vita and Calm. So at this moment, yeah, you have another option, you know, like the 2 Vita, 1 Calm. So it's more than 2. For example, 2 Calm, 2 Vita, all in all is 4. 4 is better than 3. Understand? That is the reason why we say more is much better, especially for those person who is much more serious already. At this moment, not only one wristband can really see the effect right away. Understand? Yeah.
So
That is
ibig
what I mean.
sabihin po, mga 4 na piraso ang susuotin. I see. Salamat po.
Kung kaya man
Pagka,
lang.
sir, pagka ano po,
Kung kaya
halimbawa
man lang.
may,
Pwede kaya
may
mag-start
fatty
ng
liver.
Fatty liver. Oh,
Po.
the person
Yes,
also has a fatty liver.
May I
Opo.
share something?
Meron pong fatty liver.
Opo, yung ano ba, yung fatty liver po.
So meron na
May
siyang
problema sa
may
liver.
diabetes na siya, tapos may fatty liver pa siya.
Mhm.
Or it's a different person.
Different
You're breaking up. You're breaking up.
po. May
You're breaking up po.
As, your Wi-Fi is not.
Sa pasyente po na may fatty liver, ano po ang po pwedeng ipasuot? Vital din po?
So magkaiba sila. Iba
Opo,
yung
magkaiba.
iba yung diabetic, iba yung fatty liver.
Opo.
Okay. Yes, Dr. Marilyn. You will share
Okay.
something?
Yes,
Yeah.
I would like to share something. When we were introduced to this wristband, it's through my trust with a friend, Josie.
Mhm.
She just invited us to do on this wristband, do the Zoom meeting and 3 to 4 times. And between Raymond and me, I'm the one dealing with the mainly on the health issue, but now Raymond know that, but that is the one dealing with the financial, the monetary, the exchange of money. So after listening to 6 Zoom meeting, I just heard about Dr. Manaay. And his history is really amazing for me because with his creatinine doing the hemodialysis, his creatinine go as high as 1,000 plus. Then after using the Blessingswave, it went down to 300 plus. So afterwards, I decided to use it. And my main problem then was palpitation. But probably a year or two before that, my sugar went up. And sometimes our diseases, we could not choose. What happened is because of the situation happening, sometimes condition come out, like the diseases. Like if all of us know diabetes is not only hereditary, but it is now being epidemic. Okay. So especially juvenile diabetes. So after we decided to have this wristband, I just used one Vital. And honestly, my palpitation was gone. Okay. But I continue listening to this Zoom meeting. And so after, when the wristband arrived more, I asked Raymond, I don't know about you, how many wristband you like to get, but I like to get 6 wristband for myself. But my main problem was gone, which is the palpitation. But I know within me, there are so many other things that I have to work with, especially using the calm is very, very good for me. So what happened now is that's how I try to share with people. The first thing I will get, if I will say to my client, is that if you are interested to heal yourself, because the healing is not from the medication nor from the Blessingswave itself. The healing is from within us. Our body needs to be given an optimum situation. So, like say, how did I choose for myself to use more Blessingswave compared to taking even the supplement or medication? See, most of the supplement and medication, you have to maintain it on regularity. But the wristband, I can use it every day with no problem. But actually right now, I'm having some of the rashes, but I don't consider it as a rash because of the wristband itself. I consider it as my body is throwing out toxins. And funny part, if now, because I know the acupuncture point, the rashes that I have is not related, it's not connected only with the where I put the wristband. Like say I put my wristband on my wrist, but the rashes coming out is from my legs. But did I have rashes before? Yes, I have lots of rashes, and my mom, who don't know anything about this natural way, she would just put sulfa, and sulfa is not good for the kidney as well as the whole body. So my statement is only the more you get, the more the wristband, the more your body would be helped. I'm now in my senior citizen age, so where else can I get something that would help me out? Now, with regards to the fatty liver, It's really because the liver is the main, one of the main organ for detoxification. Most people are being dealing with medication, and even for me, because of my doctor, telling me, Marilyn, why don't we use this? I started using metformin, but it really did not lower my sugar, because my problem with the sugar is on my brain. Like, Raymond and I have 6 children, and it's not easy to be a mother of 6 children. And most people would know that. So now when I use the wristband, my blood sugar went to normal, and it depends. So
Wow.
I do the journaling. So that's what I would just say something about the wristband. The more, the better. Now, when it comes to financial aspect, it's even cheaper, like that.
Yes.
So
Yes.
that's all.
That's true. For the
Thank you.
medications right now.
Oh,
Thank you, Dr. Marilyn.
you're welcome.
I always like to hear your testimony.
You're muted, Dr. Wo. Dr. Wo,
Can you
you're
mute? Can you mute? Doc, can you cannot hear. Yeah.
Yeah,
Yes.
more is much better.
More is much better because
Yeah, based
when
on
you
our
like what Dr. Marilyn said, if you will
yes,
compute the medications for the fatty liver and for the others, including the results from having a fatty liver, the person would pay more, and
yeah.
it
that's
will
the
Who
side
create
knows?
effect.
more
Who
more
knows?
problems
Maybe,
also
maybe
because
the
our medicine is buy one take three.
buy one take three. Yeah,
Follow up.
especially for the digestive system and the urinary system.
Yes.
Because liver
Yep.
and the
That's
kidney
true.
is the 2 organs for the main detoxification. Whenever you follow medication for a long time, the first organs, the first body system will be showing is the digestive system, either liver or the stomach. The second
That's true.
one
Yes, the
is
number one is the
is
stomach.
the kidney. That's why you have
Yeah.
heard so many story about that already. Okay,
Mm-mm.
so of course,
Ah,
we would not be able to identify what is the cause of a liver, fatty liver. So regarding fatty liver, depend on the percentage also. Okay, if the percentage of the fatty liver is not so big, do not worry about that because everyone have a fatty liver. Okay, the
Yes,
second
that's true.
one, whenever the percentage of the fatty liver is high, should be careful because fatty liver is the first stage of the liver cirrhosis,
Correct.
fibrosis.
Yes.
Then
Yeah,
fibrosis
like what
is the stage before liver cirrhosis.
cirrhosis.
Okay,
Yes.
after
Yes.
cirrhosis, better to me not to talk about that.
Yeah. Yeah, I think we know that. I think we all know that. Anyway,
That
I
is a
will call
procedure.
on Doc, I will call Pastor Rex.
Follow
I
up
think
question lang, ma'am.
okay, sige po. Follow up question.
Doon
Yes
po
po.
sa more wristband sa vital para sa diabetic, yung 4 na yun po sabay-sabay na isusuot.
Yes.
Can.
Yes.
Can.
Do that.
Yes.
If he is not really
or-
suffer from the insomnia, okay, of the nerve pain, because when you talk about complication caused by diabetes, it depends on the person. Okay, if you are lucky enough, then you will get all complication. Okay, then for some maybe only 1 to 2 kind of complication. So if the nerve problem is not so serious to him, then at this moment focus more on cardiovascular. And cardiovascular, there's connection with the kidney also. It's good for all. Good
That's
for
true.
all. So
Yes.
yeah, vital.
I will just ask, how many are you wearing, Dr. Marilyn?
As
On a
of now,
regular day?
I'm wearing 6.
6. How about Kuya
I'm
Raymond?
I'm wearing 5 the whole day, night, even at night. Yeah.
Okay, how
What
about you,
I
Doc?
do,
How many are you
5.
wearing?
5.
5.
True.
Okay,
what
I'm
I
wearing
do,
6. For me, I'm wearing 6.
Holy cow.
Okay, so no problem wearing all of it at the same time. No problem.
like
Just for the person who is diabetic, who will use the calm, if he will buy 2 calm and then 2 vital, our suggestion is that just no driving whenever he is going to wear 2 calm. He has to try it first because he might really feel very, very sleepy with the calm. But if not, if he will not be sleepy, then it's okay for him to use it
Thank you
the
po.
daytime, even on the daytime. Because that's what Dr. Marilyn and Doc using. They can wear it on the daytime and they don't feel
Yes, I
sleepy at
do.
all.
Use it.
Yes,
Yeah,
and they
no
don't
problem
feel
for me.
sleepy. They don't have
I
a
feel much
problem
better.
wearing calm. Yes. Is it okay, Emanuela? Did we answer your question? I
I
think she
don't
didn't
see
If a
hear
her.
me.
person is, I'm
Ah,
sorry, my
okay.
name is Diana. I'm calling from the US.
Yes. Hi, Diana. Yes. You have a question?
Yeah, I have a question. So I have to remain calm. I mean, I am normally calm. I'm a very calm person.
You're a very
And so
calm
if,
person.
yeah, but I have like so many responsibilities that I have to be
Correct.
on. So should I wear the calm when I go to sleep or when I want to go nap only?
Can I share
Yes,
with
Dr.
you what happened to me? Okay.
Oh yeah, sure.
Basically, I wear all the 3 different wristband. Okay. Although the description there, you know, when you are sleepy, when you're going to sleep, you remove the max and the power
Max.
and the vital. Okay. But what happened is when I feel really tired, it doesn't matter whether I have the max nor the vital, I still go to sleep and I sleep soundly.
Yes.
Okay, so what it means for me, just a reflection on my part, is that the one in charge is not really the wristband, it's my own body. But these wristbands are helping my body. But then when there are stressful situations that I could not sleep well, I would remove all this vital and the max, but then I would use, although I just have basically 2 calm, I would use an extra calm. So I will use 3 and the effect is still good. So how did I know that? Just sort of like cooking, you know, you have to put something, a little bit of salt, a little bit of sugar. That's how I look at my body now, you know, especially with this Blessingswave. It is very safe and it is very, you know, non-toxic, and I don't need to maintain much of anything. Imagine this one, I'm using this for my water too. And I'm using, the reason why I'm using this on my necklace is because I noticed every time I use the computer for quite a while, you know, I would be feeling tired. But then when I started using this, my vision is still good, you know, like that. Now, with regards to you mentioning that you are always calm, the calm,
Most of the time, but not always.
yes,
Only
but
when I don't worry about my son or my son disturbs my peace of mind.
yes. So between Raymond and I, my husband Raymond, who usually asks questions, I'm more the one who speak out, and when I'm sort of agitated, I will say something, you know. But for him, he's always the calm one. But I know deep inside him, there are so many questions that he is questioning. So he's just quiet. But then when we will discuss something, I will basically ask him the way I ask myself. And yes, he is outwardly showing himself being calm, but inside he has lots of challenges. Like, I don't mean challenges, it's more of like question in his mind that need to be addressed. And when it is addressed, that's really when he is calm. And you know, being with him for 40 years now, sort of my frequency with him is so clear, you know. But then when I would ask him, Raymond, how are you doing? Oh, I'm fine. I said, no, you are not fine. Tell me more. So like
You can
we,
detect.
like
Lying.
most of us need calm, especially when you have a child.
Yes.
So much more when you have a challenging child, you know, like that.
Yeah.
So feel free to use calm as much
Dr.
as you can.
Marilyn,
Pardon me?
the situation right now, we all need calm. The world
Yes.
situation right now, we all need calm.
Yeah, we all
Yes.
need calm.
We all need
So
calm.
the only
I guess-
challenge for me now is how much I'm gonna use and how much I spend. And I guess that is also all the challenges for all people. Why do I need to have more when one wristband address already my palpitation? Why? Because what I know is I'm already a senior citizen. All those problems that this lady we are talking about, osteoporosis, arthritis, you know,
Yeah, I suffer
senior
from knee
moments.
joint pain because
Yes.
ever since I had a fall on black ice and hit my head, and I felt my joints. I even had a surgery on one
Yes.
knee, but I felt that the other knee was bad, but I had to continue going to work. So
Yes.
but yeah, and like when winter comes, like right now,
Oh, that's very
or it
Very
painful.
rains,
difficult. Yeah.
That's
Like
very
yeah, I feel
painful.
my knees like stiff
yes. Like
and with
we
pain.
live in a 2-story room, a house, you know. Just walking up and down, I'm fine. I can walk up and down. But when I started using the Blessingswave, it made me more agile and more, you know,
Agile.
better
Yeah.
to walk, you know, like that. So when I become aware of that, because, you know, sometimes you don't think of that, but when I become aware of that, I always tell God, thank you so much for addressing me this. And I've been talking to Josie. Well, Josie, I'm glad you mentioned that to me, you know. So I always consider this as a blessings, you know, like that.
So that's where the Vitality helps. The ankle bracelets, like one on each
Yes,
ankle.
I use one of it, but I don't feel that it's only the what's this, the vitality, even the thing I put on my wristband. But there were times when I use this, connect all of them and make it become a belt.
Yes.
Yes.
You know.
Oh, you can connect
Yes.
them too?
Yeah, and
Yes,
made
you
it
can.
like a belt.
I will
you
ask.
know.
Yeah, I will ask Kuya Roger to. I think he will share something regarding the wristband that he put as a belt.
Yes. Okay. So
Yeah,
Okay.
Kuya Roger.
I just have one question more. Like
Yes.
when, you know, I have some client that's talking about this with negative or darkness, as Master Lester said, anting. But they look at it as more on the negative side rather than the positive side. Like for me, I have no qualm. I have no doubt that this is a blessing for me. Acupuncture has been a blessing for me. And that's even my gateway going into naturopathic medicine. But what I feel sorry is about most of these people that asked me about this wristband or acupuncture being on the negative side are people who could not decide for their own. So I hope and pray that most of us would be able to decide how much we have to spend, you know, like that, especially for women. Sometimes the decision making we have would always depend on someone else. Let's start to have our own decision making, but choose it in the right way.
Oh no.
Okay,
I make the
thank you.
decision making. Always.
Yes.
And if man doesn't listen, I just walk away.
Yes.
Sounds like my wife.
Yes.
That's really good.
Yes,
Okay,
Kuya
thank
Roger.
you.
For
The
those
floor is
people
yours,
that
Kuya Roger.
Kuya
Yeah,
Roger,
Kuya Roger.
can I butt in, Mama Ricon, just
Yes,
to with the flow, okay?
Yes,
Because I was trying to do this. It will help also. Here's my observation, okay? Within the first week, I tried to use all the three, okay? Now, I always use now the two because when you listen to this presentation, okay, the one that make you calm, I accidentally made a mistake. I put it under my pillow, the calm. What
Yes.
happened? When I woke up that morning, I don't want to wake up. I said, what's the matter? Something is wrong. Then I found out
Yes.
I was putting the cam on under my pillow. So it is correct. If you drive, do not put that around your neck because you will feel so comfortable and you're gonna be feel sleeping. And I took it away. So I'm using now the anklet and the other one, the how do you call it? The vital, yeah.
The max,
Beginner.
the
Because
super,
when
the
I went
super, the red.
to the golf auto shoe the other day, I had to
Yes.
stand and walk 3 hours. I never look for a chair to sit down. I'm
Wow.
okay.
You can try the red
Yeah.
max, the super max in your
Yeah.
ankle when you're playing golf. When you're
Oh, I
playing
will
golf.
do that.
Because
But the weather is still, the weather
no,
is not
because
cooperating. Okay.
because
Okay, Kuya Roger, you can go ahead now. I'm done. Thank you.
Okay.
yeah.
This belt was inspired by Ma'am Maricon because
Yes.
she said that she used to connect
2 to 3. Yes.
around her waist.
Wait,
So
yes.
so I thought about making a belt. I did the first prototype, which is just like this.
Yes.
Like that. Then I come up with the second modified belt, which is much better because you can adjust actually the if you want to lengthen the belt, you can adjust it by adjusting the Velcro.
Yes.
See,
Uh-huh.
the
Wow.
one side of the belt is longer. It has a longer Velcro than the one on the uh, wristband.
Other side.
Yeah. So you with the longer Velcro, you can adjust the waistline. So now I use 4. Actually, I use 4. But with some modification, you could put in more six units, but you have to cut this to shorten it. You have to cut it to put more belt. As of now, I'm using the belt because this is where most of our major organs are located.
Yes.
Yes. Yes.
So
Yes. Prostate is there, reproductive organs are there,
yes,
intestine is
Digestive
there,
system,
yes. All.
urinary
Yes.
system, reproductive
Urinary system,
system.
yes. All.
everything, majority of
Everything,
our
yeah.
system.
Majority.
So because Dr. Ro suggested that we use vital. So here it is. Most of these are all vitals.
Vital, yes. There's a green there, yes.
Yes. But
And not only
later on,
4.
4. Later on, I could
4.
make adjustments and maybe add calm
Yeah.
to this. So
Yes.
at
And not
least
only
now
that, we have to
modified-
change our diet.
we have modified
Yes.
belt already where everybody could make a copy. I have sent,
Yes,
I think, I don't know if Raymond has received the belt that I made
The
for him.
Velcro, with the
Yeah.
Velcro.
No, I don't think because Velcro is available there anyway.
Kuya Roger, ang mahal ng belt mo.
Huh? Oh, not only two. You know, this is very cheap. Remember, how many
because
organs did you hit?
Si Kuya
One
Roger
go.
was
30
able
mil ang
to
isang
think
belt mo,
about,
talo pa Louis Vuitton.
can you imagine he was able to think about that? And for us, I just
Good,
put
Jan,
it
good.
inside my, I just put it as a belt.
Usually tell one another with Raymond, how much is your health?
Yes.
How expensive is your health?
Yes.
Yeah.
So this is it.
Yes. Yes.
Tama,
Wow,
tama,
thank
tama.
you,
Correct.
thank you.
Tama.
Thank
Thank
you
you,
very much
Kuya
for
Roger.
sharing, Kuya Roger.
Kuya Roger,
Thank you so much.
Kuya
Oh,
Roger, naunahan mo na ko. I'm
you
trying
can
to make
order the
that.
belt from me, including the wristband.
Oh. Yes,
Kuya
you can
Roger,
order.
Just
I
joking.
have a prototype soon about the belt for golfers.
For
Yeah,
golfer.
nice.
Yeah, I like that. I
Yes.
like that. Yes,
Okay,
yes.
show us
Yes.
the trophy later. The trophy.
Yes.
Ipapatin ko pa eh.
So,
Susukatin pa.
yan na.
Yes. Suot na. Suot na.
Nice, 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 nice.
Yes, actually, it's nice. Yeah, it doesn't, oo nga naman, hindi matatanggal.
Hindi
It's
na
not easy
tatanggal.
to take off. Yes.
Yeah.
Oo.
Except that sometimes when you
Hindi mawawala.
expand your stomach,
Yes.
it get
Yes.
loose.
Yeah.
Yes. That's true.
So that's my
Correct.
contribution
Pacquiao
to
might be interested.
our host.
Okay,
Pacquiao.
thank you. Thank
Thank
you,
you.
Kuya Roger.
Thank you, Kuya Roger. Okay. Yes, thank you, Kuya Vito.
Oh, no,
I
no.
would like to
I'm just see bye-bye, whatever. About to do something,
I would
you know.
okay. Okay po. I would like to call Pastor Rex. Si Pastor Rex. Yata, I think Pastor Rex,
Yes.
are you going to ask something or you're going to share something?
Regarding good evening po. Good morning sa lahat. Okay. For me, for my testimony is actually she is actually a cancer patient. Yeah, the breast cancer, and she cannot walk for a month, and she's just lying down, and his left leg actually is aching every night, so she cannot sleep. So I put the anklet, which, and then the two. I put the one I think it's what's that? It's vital, and then the other one is in the his hand. So she told me that when I put in the anklet on their hands, she told me that it's no, it's painful for a while, and then it's so painful, and then she just he just said that maybe she can sit down, and I told her just to walk, maybe she can walk, and she actually she got up, and she can walk, but before she cannot even walk for and she had the somebody who who hold her to walk.
Assist.
Yeah, to assist her, but it's a blessing. It's a blessing to her, so she can walk right now, and the pain is gone, and I'm going to visit her maybe the other day to once again to visit her and to ask her regarding her health. So Blessingswave is it's a very blessings to us, and especially to me. So actually this night I am late for the because my boss arrived at Puerto Princesa. So he looked at me. He looked at me. Oh, you look young. And but you look young, Pastor. And what's your you do you go to gym? I said no. And no, this is actually the this is the one who give me
The
strength.
secret.
Yeah. Actually my my stature is he said it to me that you're different right now. You look young, and you look so I am amazed. Even my boss told me that and asked me what my secret. So my secret is actually is here. Is the so I'm working. In the manager. I'm actually managed 2 hotels in Puerto Princesa. So I have to go there, and I have a lot of works. So but I until right now it's going 10 o'clock, but I'm strong because of this. Okay,
Wow.
and
Yes.
And my wife can sleep well now because of the cam. He put it every
Yes.
night. So even I can, if I know I'm going to hey, come on, go, get up. She just humihilik because of the cam.
Yes.
So it's a blessing for us, and it's I think no, it's a great blessing. The Blessingswave that no. Thank you, Ma'am Josie, for sharing to me this the great opportunity, of course. Great products, the great products. Even the name itself is a blessing. It's a blessing from God, and
Yes.
the company is a blessing. Thank you very much.
Yes. Yes.
Thank
So
you.
it's time. Thank you. So it's time
Thank
for
you.
you to share. It's time for you to share it to your blessing to your boss.
Yeah. Yes, ma'am. Yes.
Yes. Yes. Thank you, Pastor Rex.
Yeah.
Thank you.
The complaint is before using the cam is the cannot sleep at all. Okay. After using the cam, and the husband or wife is the one who complaining that always falling asleep.
You're being naughty.
Yes. Doc is always a naughty whenever it's our. Yes.
Right, that's the correct. You are
Correct,
the one
correct,
who
correct.
wake your
Yes, yes.
wife up.
No, you know, the calm
Yeah.
is really very good for sleep. Honestly, even for me, I really have to wear calm every night, but I have to take it off when I before I wake up. When my alarm sets, I have to take it off because I will not be able to stand up if I will wear it. That's how effective it is for me, and that's how it's really very good. All
Yes.
actually, even the
Yes.
max, the
Stress
super.
is the silent killer, really.
Yes.
Okay.
Yes.
You will not see the risk of a stress right away, but
Yes,
later
you
on
can
you
be
will
stressed
see.
in the whole day,
Yes.
but when you're sleeping, you
Yes,
cannot be
that's
stressed
why.
anymore. You
Yeah,
have
number
to
one,
have a
see
good
that.
sleep.
That is the reason why I really love
The
Tom
next
very
day,
much.
another stress.
Tom is really the one to take out the stress, to take out the
Yes.
risk. Okay, that is the
Yeah,
Tom. Okay.
Kuya Raymond has a last question.
I hope this is the last question, Doc. Anyway, I have a good
You
friend.
hope? You hope? I should be the one to say that.
Anyway, I have a best friend, a medical doctor. How can I invite her to join the meeting when, like, every time I introduce this to her, say, "Oh, there's no scientific proof, or there's no effect on that one," without even trying it. So how can I convince her to please come and join, and maybe you can ask questions and listen to the testimonials and whatever. Look, how can I encourage her to join the meeting?
I will answer that.
Okay,
Yes.
please.
Next, you answer that.
Yes. Let's.
The parachute will be more effective if it is open. Okay. If the parachute is not the parachute, it's more effective if it is open.
Open, yeah.
Correct.
But if it is not open, for sure you'll die. Patay. Na anong point yan? As long as they're open, okay? As long as they're open, they're going to, you will find time to sit down with the product that we're going to share. But as long as those people, or even not medical people, they're not open, even though we have the best study right now, because quantum science is already having a lot of studies right now. Tanong ninyo kay Mr. Google, mag-Google kayo about quantum physics and quantum
Dr.
science.
Google.
Okay? Punong-puno na po ng research yan. But the problem is, of course, the medical community will not accept this one. Why?
Mm.
You will lose businesses. Okay? We
Mm-mm.
are
I
only
think
looking
mm-mm,
people who is already open for
mm-mm,
just to listen.
That's true.
mm-mm,
You cannot
mm-mm.
force them
Correct.
to,
I think yeah. Mm-mm.
Yes.
Yun lang, Kuya Raymond.
Yeah.
Yun lang sagot to.
Oh, thank you.
Yes, correct.
You're saying
And
something, madam?
maybe we can also ask Miss J regarding that because she has a doctor in Bacolod, Dr. Benedicto, who is a well-known doctor in Bacolod. But she was able to get her, right, Miss J? She actually testified already in so many of our Zoom before, if you remember, Dr. Benedicto.
Yes,
Even in
yeah.
the Sunday, even in our Sunday, although she still have some questions, but what she felt with the product made her convinced her what she felt with the product. I think that's the bottom line there because she experienced it by herself, even if she is skeptic because she is a medical doctor. But when she used it, she was able to convince, but she still have questions, right, Miss J?
Yes, actually, she tried the ankle band because her problem is her leg. She's having leg cramps for many years already.
Yes,
And I was also surprised when we went there with my sister Miles to her clinic, and she said, I've been suffering this for many years already, but I was relieved for one night only when I wear the ankle band.
Yes.
That's
Yes.
right.
So the product
She's
will speak
wearing,
for itself.
yeah, she's wearing
So
the
that's
ankle
the most
band.
convincing. That's the most convincing way to do it, to make them,
Maybe
attend,
pasuotin na lang
to
natin.
make them
Pasuotin na lang, then the
curious.
science will follow, right?
Yeah.
Yes. Make them wear it first. Make them wear
Madam
it.
Jose, ganda ng t-shirt mo ha.
My uniform.
Shirley, sir, I
Okay.
just want to, that's true that if the parachute is not open, then you cannot, you will drop dead, because
It's useless.
sometimes she wears the wristbands and then she feel like something happening and she can feel something different and she just suggested, why don't you drink water? And then she just said, oh no, I'll just take off my
Plain
wristband.
stubborn.
Yeah.
Waters are
So
always
that's
important.
Oh, meron
So-
talagang ganun.
Ano lang yun, they always have
the reason. Anyway, I just want to share something about my experience with the calm. I know I've been sharing this before, but maybe there are some new people. So, after Dr. Wu mentioned to Dr. Marilyn that she's gonna be presenting do the product presentation, I know that the next time doctor gonna ask is it's me to present the marketing plan, and I was only about 2 months from being introduced to the Blessingswave, but I've been watching or listening to Dr. Wu's presentation every time we have a meeting like this on Saturday meeting for North America. So when Dr. Wu mentioned that Dr. Marilyn, you have to present your product presentation after the marketing plan. So I started preparing myself to uh, uh, do the marketing plan presentation. So that's how I learned my first ever learned to do PowerPoint. Yes. So anyway, to make the story short, because it's already 11. Anyway, to make the story short, everything is ready. We did practice with Sir Joey and so on. The night before the presentation, it was already like 3 o'clock in the morning. I could not still sleep, and I'm already wearing one crown. So Dr. Marlin noticed that I'm still turning on my bed, left and right, and she suggested to me to wear extra calm, and so I did. And once I used, after I put it in my one of my the other arm, and then I lay on my bed, and I didn't even remember that I fell asleep. I just like sort of passed out and woke up 6 o'clock in the morning refreshed. And so that was my first experience really with how can work
Yeah.
when you are
It's,
successful.
we call it TKO.
Yeah.
Knockout. Yes, yes.
I
Okay.
call it
Knockout.
bio. I call it
Technical
BRT.
knockout.
I
But
call
it
it
was a good,
BRT.
but it was a good knockout because I really, it was really a very, very deep step. I don't even have a dream. I think I like if you call it I'm dead. Yes, it was that word. I was dead in that
Okay.
moment.
Thank you. Yeah.
Okay.
Thank you,
Okay,
Kuya
thank you very
Raymond.
much.
One more time.
Thank you, Kuya Raymond. Yes.
Okay.
One more.
Okay.
More.
Yes.
One more.
Yes.
One more.
Yes,
One
Kuya
more.
Roger. Yes, Kuya Roger.
Roger.
Is there anything actually Blessingswave has been doing great, and sometimes I always tell everybody that the what Blessingswave would do is very close to miraculous. That's what I
It's
always say.
miracle.
It's miracle.
Yeah, very close to miraculous. Now,
It's not close. It's miracle.
okay. Anyway, there is one thing that I've just read. What can we do on alcoholic person? What does the Blessingswave can offer to them?
Change brand.
Water.
So
Sir
it's
Lester
good,
can
at least we
answer
could
that.
help them sober up and maybe change brand to water.
Johnny Walker.
No, not Johnny Water.
Alcoholic.
Yeah, for alcoholic, because we can hit lots of words actually if we go to drug addiction center.
Okay, tell them to wear more, you
Yeah,
ask
but
them
we still have
to
we
all
still have to
three
convince them that
because they are bombarding their liver
You
with
got
too
it.
much chemicals in their body.
Chemicals, yes.
I think they have to wear
Oh, they have to prepare
vital,
for their liver.
vital, 4 vitals.
All.
I think.
Wag
May
damihan, baka
suggestion
hindi
is all.
Kuya Roger, wag
Wag-
damihan, baka hindi na malasing. Inom ng inom.
For me, no max, because they will feel more energetic to drink.
Kaya
So
nga,
more
hindi na
on
malasing,
calm and more on more on vital and more on calm.
Hindi na matakot kasi nandiyan naman yung vital to take care of their liver cirrhosis.
Liver, yes.
No. That's not how it.
Bad question.
That's not how it goes.
Actually, wala pong
Change
gamot dyan, Kuya
lifestyle.
Roger. The best niyan is
Yes,
mamimigay
remember
siya.
the presentation
Mag-aya siya.
earlier. He just even if we do all of these things, if our lifestyle is bad and worse, it's useless. We're
Yes.
just it's useless. If you will still drink Coke and you will still drink alcohol,
And then
even if he cover his body with all the wristband, it's useless.
And then they will say that the wristband is not working. Logi ka na, Sir Lester.
Yes, correct. Yeah, Logi na, yes. If they will say, it's not working.
Babalik sa'yo yung,
No.
they're gonna give it
Actually,
back
the
to you.
wristband is very effective on me because while we are drinking, could you imagine all of us is wearing five max? Ang tagal
Yeah,
namin
you
malasing,
will
no?
not.
Oh.
Yes, you will not. No, that's
Yeah.
true. That's true. That is true. They're
Ang
very,
init sa
very true. That's
katawan.
why, because you will get more energy, so you don't feel drunk. You will not get tipsy. You will get more alcohol. You will drink more because you are more energetic. You have more no. So totoo yun. Tama yung sinabi ni Lester.
Yeah. But
When
then
you're
at the
wearing
end,
max, when
But
you're
don't try
wearing
yan,
max,
Mama.
the
Don't
more
try,
you
don't
will
try.
drink. The more you
but
will
then,
drink.
but at the end, it's your liver and your kidney will
Yes,
suffer.
correct, correct. Yes, yes.
Hindi, sa
I'm
totoo
sorry.
lang, no? When I'm
Lifestyle,
wearing
lifestyle,
our
guys.
wristband,
Lifestyle.
wala na akong kagaganang-ganang uminom. Kasi unang-una, ang mahalan Johnny Walker.
Lifestyle, lifestyle. No, it's really,
Okay,
you know.
so now it's
Okay.
11 already. We have to finish
Yeah.
our meeting.
One question.
It's too early.
Yeah,
It's
because
too
you
early.
know,
It's too early. For them, for them.
because it's early morning to Kuya Remo.
They, wait,
Yeah, it's
it's
9
Diana.
a.m. here in
Miss Diana, you
Central
still
Time,
have a question.
USA. I just have
Yeah.
a question. For people that smoke,
Smokers. For
yes.
smokers.
Calm,
Tell-
calm.
Yeah, they have anxiety, right?
Sagot mo, ma'am.
I know. We will put here.
Well, from
Anyways.
smoking cigarettes.
Anyway,
for
okay. When you talk about smoker, okay,
Yeah.
we have to talk about the risk of smoking first.
Yeah.
For drug
That's
addiction.
Okay, if they do not know the risk of smoking, then all the solution is useless.
Correct.
Yes.
Honestly.
True.
Okay.
Yes.
Yeah.
Mm-mm.
So
Yeah, my
if you
roommate
talk
has
about,
been
if I talk about
quitting
the
smoking.
risk of smoking, including the cardiovascular, including respiratory system, including the cancer problem, right? So
Yeah.
at
Anyway,
this
your
moment,
husband,
yeah.
your husband
No, my
is the
roommate.
ones. Your
Yeah,
roommate.
so smoking
So
really
she's
creates so many problems.
if you,
So aside
yeah,
from
if you,
aside from stop smoking, there is no any
lack of
support or any
oxygen. Yeah.
solution for that at all. Okay. So the second one, if you would say that okay, smoking is the reality, unable to stop. So you want to you are thinking to find some way to avoid the risk caused by smoking. That will be we can discuss. Understand? Otherwise,
Yeah, and
smoking is So
yeah, the reason why
regarding
it's a part of PTSD because of he was in the couple of wars before, 5 battles. So like he has
so
like recollections.
he has a PTSD.
Yeah.
Yeah. So he has been on nicotine gum for 2 years. No smoking.
Wow, that's good.
Okay, that's good.
But
Cheers to a cigar.
But
he likes to quit nicotine gum.
so
could still,
he wants to quit nicotine gum. Is
So
that what?
So what would help for like drug addiction or like withdrawal symptoms? The vitality and the calm.
For withdrawal symptoms.
Anyways, so the other one is for people that are like anxious, depressed, speed racers.
Calm.
Like they speed a little bit on the highway. That's my son.
Calm.
So so for them, the calm and the vitality.
Yes.
Hold on.
Yes.
Can you write the suggested
I'm sorry.
information? Yeah, so that after the meeting, you might not remember or confuse. So then you have something
No,
to
she's
get
what she, yeah, but she's asking is for the withdrawal symptoms.
Yes,
And
but
another
what
one
will-
is for the stress, for the
I know water is important for everything, and food,
yes,
and
of course.
and
No,
teas and
especially when
vitamins.
no,
Not
no,
just
no.
this.
No, because we always advise if you were able to listen earlier for the from the with the presentation. We always advise that whenever you're wearing the wristband, you have to drink more water.
Yeah, I always miss that presentation. I just get on the testimonials.
Okay. Anyway,
Here
we
it's
will.
9
I will
a.m.
just send the. I will send the presentation. I will send the this presentation.
Where
This
is this made from?
recorded. This recorded.
Made
I
where?
Which one
Which one?
is made?
Where's this science made from? Where's this bracelets made from?
From US.
Not in the US, right?
No, the technology
US.
is from US.
Yes.
Technology is
what-
from
where
US
else?
because quantum resonance is from yes. Technology is from US. It's a Tesla technology. Anyway,
Yeah,
I will
awesome.
just
Okay.
okay,
Thank you.
I will send the videos of this presentation tonight to everyone in the Telegram.
If there's one in English,
And
that
then
would be
you
great.
Yes, it is. It was English. This
I thank you.
presentation, this recorded video presentation is in English. It was Dr. Allan who presented tonight.
Dr.
We're
Allan.
just sorry that you were not able to. Yes, that you were not able to listen earlier. You just arrived during the testimonials, but maybe you could listen to that so that you could have more
Knowledge.
knowledge about
Information.
it. Then information. Then maybe later on you can ask Miss Mamlu, who invited you, if you still have more questions after you watched it.
Okay, this is my second
Is that okay?
time, so I thank you. Bye.
All right. Thank you, Diana. Okay. Thank you, guys. Thank you, everyone. It's already
Thank you, everyone. Thank you.
oh,
Yeah.
it's 11:15.
11:15.
You can
Yeah,
still go on.
We can still go on because it's morning there.
Fine with me.
10:15 morning.
Because it's yes, it's morning there, so you can still go on if we can
It's
tomorrow.
not even noon yet.
Yes.
Okay.
Thank you, everyone.
Okay, thank you.
I will
Bye-bye.
send the videos.
Thank you.
Mind me. Okay. Thank you. Thank you.
Good night.
Kuya Rito,
Pastor
my
Rex.
suggestion to
Thank
you,
you.
your Max, put it in your leg.
Yes, thank you.
Yeah.
Good night. Thank you,
Good
Pede.
night.
Good night. Good night, everyone.
Thank
Good
Josie
night.
for your sharing and
Thank you,
Pastor
Pastor
Rex.
Rex.
Thank you. Yeah.
Pastor
Thank you
Rex.
very much for your sharing.
Yeah,
Thank
good
you,
night
thank
sa
you.
lahat.
And to Boy.
God
To
bless
Boy
us all.
Amor.
God bless us all.
God bless us all. And
Thank
be a
you.
blessing, guys. Be a blessing. Don't forget the Wednesday pala ha. It's marketing plan. It's Doc Allan also who would present the marketing plan. So see you all.
Thank you, Mom.
Thank you.
Thank you,
Thank
Miss
you.
Mary. Thank you, Bacolod.
Good night, Philippines.
Good night, Kuya Rito.
Good night, Philippines.
Good night, Ma'am Lu.
Hi, Mama Icon is available now.
Yes, okay.
Huh? Is it available the Vital?
We'll tell if I will text you in our group.
Yeah, okay.
Okay po.